Okay. So hello everyone, very good evening. So hello everyone. Hello everyone, very good evening to all. So as indicated in all groups and all, today we have conducted second mock test, okay, mock test 2, which consists of all India GPAT mock test 2. So in the previous session we have covered about all India GPAT mock test 1. Yeah, thank you very much. Thanks for the response. Okay. So whatever we have gone through in the previous mock test. Okay, so we have conducted second mock test also, mock test 2. Okay, please stay updated, stay connected, and stay updated with us till the time of examination. We are also coming up with certain the last minute tips for GPAT examination and all those things. So please confirm whether the screen is visible and I'm audible, everything okay. Please confirm my audibility, visibility and all. And also do post your questions in the chat box simultaneously so that we can discuss and we can correct whatever it is needed as on date. Okay. So without any delay, let me start with today's discussion. Okay. So first we will go with pharmacology. There are questions from different areas. Okay. So first I will start with pharmacology today. Okay. So why delay? Let me start with the first question of today's mock test. Okay, and this mock test, let me inform you before this, and this mock test is available on our mobile app. The links are given in the description box. Okay, and you all can download the mobile app. If you have already downloaded, yes, the test is already live. Okay, you can attempt the test even later. Okay, thank you all very much for your patience. So let me start with the first question. The first question from pharmacology is, read the following statements about M3 receptors. Okay, the statement is about M3 receptors. So they are G protein coupled receptors, increases the intracellular calcium, they cause smooth muscle contraction, and they inhibit the glandular secretion. So identify the correct statement or correct statements. Okay, they read the following statements about the M3 receptors. Okay, so 1, 2, and 4 only are correct. 1, 2, 3 only correct. 2, 3, and 4 only correct. And 1, 3, and 4 only correct. Is what's the right answer for this question? Yes, your answers in the chat box, please. Answers in the chat box. What's the right answer for this question regarding M3 receptors? Yes, question regarding M3 receptors. So what are M3 receptors? Muscarinic receptors. Okay, muscarinic acetylcholine receptors. And the right answer is B. Okay, the right answer is B. 1, 2, and 3 only. Okay, only 1, 2, 3 are correct and the fourth option is wrong. So we will go through a small review about M3 receptors. Okay, we'll just go through a small review about these M3 receptors. So M3 receptors. So we also know muscarinic receptors, muscarinic acetylcholine receptors. Okay, we all know about the muscarinic acetylcholine receptors. Okay, muscarinic acetylcholine receptors. Totally, there are of 5 types. There are 5 types of muscarinic acetylcholine receptors, which are M1, M2, M3, M4, and M5. Muscarinic acetylcholine receptors, they are of 2 types: M1, M2, M3, and M4 and M5. Okay, so whereas we have to remember this, absolutely, please remember this is very, 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 very important. Whereas the odd numbered receptors, okay, please remember this is not a, I don't think that can be right, but just to remember, so all the odd numbered receptors 1, 3, 5, all the odd numbered 1, 3, 5, M1, M3, and M5, they are stimulatory receptors. Okay, they are stimulatory receptors. M1, 3, and 5 are stimulatory receptors, whereas 2 and 4 are inhibitory in nature. Okay, whereas these even numbered receptors 2 and 4 are inhibitory in nature, 1, 3, 5 are stimulatory in nature. Very, very important. Please remember this. Okay, and so we all know the locations and all these things. Also, we know the location of the receptors and all. So 1, 3, and 5. The one receptors 1 is present in the CNS. Okay, M1 are present in the CNS, and most importantly, here we have to mostly note about M2 receptors which are present in the heart. Okay, M2 receptors which are present in the heart and which exhibit an inhibitory action. M2 receptors which have a inhibitory action. Okay, so these are important points about the muscarinic acetylcholine receptors. Yes, acetylcholine receptors. As we all know, there are of two types, other than muscarinic acetylcholine. Other than muscarinic acetylcholine, we have the nicotinic acetylcholine receptors. We have the nicotinic acetylcholine receptors which are of NM and NN type. Okay, NM receptors which are present on the neuromuscular junction and NN receptors which are present at the neuronal ganglia. Okay, which are act upon the neuronal ganglia. Okay, so this is about the basics of acetylcholine receptors and the right statements about M3 receptors here. Okay, so what was the wrong statement, false statement here? Okay, 4 is not right. Okay, they inhibit the glandular secretion. It was given like they inhibit the glandular secretion. No. M3 receptors which are present on the smooth muscles. Okay, especially these are present on the smooth muscles of this salivary, gastric and bronchial smooth muscles. They increase the secretions. They stimulate the secretions, not inhibitory action. Okay, so this is the right answer for the question. Okay, please remember this classification of muscarinic receptors and nicotinic receptors and their respective activity. These are very, very important all the competitive examination point of view. So there is a high probability for these questions. Okay, these questions from muscarinic and nicotinic type of receptors and their location, their activity, all these things, there is high probability of questions appearing in the examination, in the final GPAT examination too. Okay, at this last moment, go for a quick revision of these receptors. Okay. So the next question number 2, antiarrhythmic drugs. Okay, the question about the antiarrhythmic drugs. Okay, match antiarrhythmic class with their mechanisms. Okay, match the antiarrhythmic class with their mechanism. And in column 1, we have quinidine, we have lidocaine, amiodarone, and propranolol. Okay, and in column 2, we have their mechanisms of action: potassium channel blockers, sodium channel blockers, beta blocker, and shortens APD. Okay, and shortening of APD. So what's the right answer? Yes, quick answers in the chat box, please. Quick answers in the chat box. What could be the option? What could be the option for this question? The right answer or right option for this question? Yes. Could be. Yes, what it is? Yeah. Quinidine, it is causing sodium channel blockade, and lidocaine it shortens the APD, and amiodarone is a potassium channel blocker, whereas propranolol it causes the beta blockade. So from our options, yes, what's the right answer? Is A to B4. A is the right answer. A is 2B4. Okay. So we all know very well about the classification of antiarrhythmic agents. Okay, classification of antiarrhythmic drugs we know very well. Okay, the class 1. Okay, just let me go to my next slide. Okay, it is showing. So the classification of antiarrhythmic drugs showing class 1 drugs which are sodium channel blockers. Sodium channel blockers showing 1A, 1B, and 1C. Okay, and class 2 showing the beta blockers. Okay. So we have various examples like quinidine, lidocaine, flecainide, etc. Okay, 1C drugs, flecainide, ecanide, etc. and all these things. And class 2, we have the beta blockers. Okay, beta blockers like propranolol and all these things, all the lols. Okay, all the lols and potassium channel blockers in class 3, amiodarone, sotalol. Okay, amiodarone, sotalol, class 3 drugs. And class 4, we have the calcium channel blockers. CCBs, very important. CCBs, the classification of CCBs is very important in almost many of the disorders, not only in the arrhythmia. They are applicable in many other disorders like antihypertensives and not only cardiovascular and the other disorders also. Okay, CCBs are important. Calcium channel blockers, again, they are of 2 types. Okay, CCBs, calcium channel blockers, they are again of 2 types: dihydropyridines, DHPs, and non-dihydropyridines. Okay, we have DHPs and non-DHPs here. Okay, like DHPs which are like pyridines. Okay, dihydropyridines, we have nifedipine, amlodipine, and all the dipines. All the dipines of dihydropyridine class, and the non-dihydropyridine class which of verapamil, diltiazem. Okay, benzothiazepine classes, verapamil, phenylalkylamines, and benzothiazepines. We have verapamil and diltiazem as the CCBs, calcium channel blockers here. Okay. So yes, moving forward to the next question. Very, very important question. Okay, very important question from CNS. We have a very important question here. The extrapyramidal symptoms with haloperidol is due to the blockade of. Okay, so commonly we go with the kinds of questions. So what are the adverse effects of haloperidol? Okay, we usually go with such type of questions. Adverse effects of haloperidol include. Okay, all or some kind of things. Okay, it is due to this adverse effect. It is due to the blockade of, and that is the mechanism of action of adverse effect. Again, see, we all very well know many times that we go with the drugs and their mechanisms of action and their adverse effects. Okay, sometimes there are questions like this. So this is a graduate pharmacy aptitude test, is a national level examination which is going to like showcase all your where you are going to showcase all your preparation talent, all these things. So mechanism of action for its adverse effects has come into picture here. Yes, some of for some of the drugs it is also very important. Please go through once as possible. Okay, the extrapyramidal symptoms is the adverse effect of haloperidol, and this is caused due to what is its mechanism of action is the question. Okay, it is due to the blockade of mesolimbic pathway, tuberoinfundibular pathway, cortical pathway, and nigrostriatal pathway. Okay, so due to the blockade of which pathway does haloperidol cause these extrapyramidal symptoms? Extrapyramidal symptom as haloperidol we all know very well. Okay, haloperidol, it may show, yes, it does show certain extrapyramidal symptoms. Okay, it is a typical antipsychotic. Okay, haloperidol, it is a typical first generation typical antipsychotic belonging to the class of deuterophenone. Okay, it belongs to the class of deuterophenones class. Okay. So how does it cause? Yes, what's the right answer for this question? Is due to the blockade of what? Haloperidol causes EPS due to the blockade of which pathway? Options in the chat box. Yes, your answers in the chat box, please. Quick answers in the chat box. Yes, and the right answer is the nigrostriatal pathway. Okay, the right answer is the nigrostriatal pathway. Okay, so this particular drug, haloperidol, it exhibits its therapeutic effect. Okay, that means it exhibits its antipsychotic activity because and by mediation of this mesolimbic or mesocortical pathway. Okay, the therapeutic activity of haloperidol is because of this mesolimbic and mesocortical pathway. Mesolimbic and mesocortical pathways, they mediate the therapeutic effect. Whereas the nigrostriatal pathway, it is that nigrostriatal pathway which runs from the substantia nigra to the striatum, it mediates the adverse effects of this haloperidol. Okay, so this is a very, very important question. Please make a note and just go through also. Okay, as possible, you just go through the options and answers. Okay, next we have a question from antagonism, question from general pharmacology. Okay, question from general pharmacology, antagonism part and the reactions, pharmacodynamic reactions, and the antagonism produced by hydrochlorothiazide and triamterene is. Okay, that antagonism that is produced by hydrochlorothiazide and triamterene is competitive antagonism, non-competitive antagonism, physiological antagonism, and chemical antagonism. What's the right answer for this question? Yes, the right answer for this question. What can be the right answer for this question? Please, your options in the chat box, please. All the participants, yes, you need to be active at this moment. Okay, you need to be active. Yes, very good. Thank you for the responses. Okay, yes. Still. Yes. And the right answer is C. Okay, the right option is option C, physiological antagonism. Okay, it causes physiological antagonism. That means it is not receptor related. Okay, when it is receptor related, it could be competitive and non-competitive type of antagonism. Okay, it is not related. It is not a receptor related antagonism. It is only effect related antagonism. Okay, it is a effect related antagonism, whereas this triamterene, okay, hydrochlorothiazide and triamterene. Okay, so what happens usually? This hydrochlorothiazide, it inhibits the sodium chloride co-transporter in the distal tubule. Okay, hydrochlorothiazide, we know it is a thiazide diuretic. It inhibits the sodium chloride co-transporter in the distal tubule, whereas triamterene, it blocks the sodium channels in the collecting duct. Okay, it blocks this sodium channels in the collecting duct. So here there is no chance of receptor interaction. There is no way of this receptor interaction. When it is receptor interaction, it will be competitive or non-competitive. Okay, competitive is a reversible type of interaction, whereas the same drugs they compete, whereas the different drugs compete for the same receptors on the to bind onto the same receptors. Whereas non-competitive is nothing but it is an irreversible receptor binding. Okay, so there is no competition, but there is a irreversible. It is not reversible even. Okay, example is phenoxybenzamine versus norepinephrine kind of interactions. So whereas here the interaction is the antagonism is a physiological antagonism. Okay, and also there is also chemical antagonism is very important. Even chemical antagonism is very important. Whereas whereby the drugs they react chemical, they interact chemical with each other, and which leads to change in their action. Okay, that which may lead to degradation or which may lead to the any kind of antagonism, any kind of chemical reaction. Okay, so we move to the next question here. Next question, PFC blood substitute among the following. PFC blood substitute among the following. PFC blood substitute which is used for liquid ventilation is. Okay, PFC blood substitute used for liquid ventilation. What is PFC? What are PFCs? What are PFCs here? What are PFCs? Perfluorocarbon. Okay, PFC is nothing but a perfluorocarbon. Yeah, please try to be active. Please try to be active. All of you? Yes, I need some responses over there. Need some responses. I need some responses out there. Okay. PFC based, perfluorocarbon based blood substitute which is used for liquid ventilation is perfluorocarbon, fluozol, oxygenate, and hemolung. What's the right answer here? Yes, perfluorocarbon is the right answer. Okay, please, I need some answers in the chat box, please. Yes, be active, be interactive, be active and be interactive. Okay, so this is a quite interactive session. Only for the sake of this GPAT aspirants, conducted only for the benefit of this all the GPAT aspirants. Yes, very good. Okay, the right answer is perfluorocarbon. Okay, so we know perfluorocarbon, perfluorocarbon. Okay, just remember the similarities or remember with the mnemonics. Okay, so it is useful in liquid ventilation and it is also used as oxygen carrier out there. And fluozol. Okay, fluozol it is also an oxygen carrier, fluozol, but it is discontinued due to its defects in the clinical trials. Okay, fluozol is discontinued due to its disadvantages which has occurred, adverse effects which has occurred in the clinical trials. And oxygen, it is also a type of oxygen therapeutic, also a blood substitute. It is an oxygen therapeutic, but it is still under clinical trials. And hemolung, it is a kind of physical mechanism. Okay, it is a device. Hemolung, it is not a kind of we can't exactly categorize it as a therapeutic agent. It is a device. It's an extracorporeal device which removes or which filters CO2. Okay, which purifies this blood by means of filtration of CO2. Yeah. Okay, so we move to the next question. Our next question is TPO enzyme inhibitor, antithyroid drug that inhibits thyroid peroxidase enzyme. Okay, antithyroid drug that inhibits the thyroid peroxidase enzyme among the following is methimazole, propylthiouracil, carbimazole, and iodine. And iodine, which is the right answer? Yes. What's the right answer? Yes. Very good, very good. Very good. More answers, please. More answers. Yeah, so the right answer will be B. The right answer here, thyroid peroxidase enzyme inhibitor is propylthiouracil. Propylthiouracil. Okay, so to be clear, to be precise, even these drugs, methimazole, carbimazole, also methimazole and carbimazole, they also inhibit the thyroid peroxidase. In fact, okay, they have a mechanism of inhibiting this thyroid peroxidase, but they do not block the peripheral conversion of T4 to T3. Okay, they do not block the conversion peripherally. They are not peripherally acting. They do not block the conversion of T4 to T3, whereas this propylthiouracil, it inhibits both thyroxine peroxidase enzyme and also T4 T3. So it is a different classification, different class of drug. Okay, it is more effective. In fact, this propylthiouracil, it exhibits more effectivity. Next question. Okay, question number 7. We have an assertion reason type of question. Okay, so these days, please remember all the aspirants, all the GPAT aspirants, you please remember these days, this assertion reason and statement based question, the most probable types of questions in your examination. Okay, are there? Our mock tests are very specific with that of the in collaboration with the GPAT board. Okay, in coordination with the GPAT board, we are continuously going in coordination with the GPAT board. Okay, mostly the statement based questions. So you can observe the previous continuous previous 2-3 years questions. So you can see these type of questions a lot. Okay, assertion reason based questions, match the following based questions, and statement based questions. Most importantly, the statement based questions are very prominent, most probable. Okay, and here we have an assertion reason question from the assertion reason, and potassium sparing diuretics prevent hypokalemia. This is the assertion, and the reason we have is they reduce sodium reabsorption in the collecting duct. Okay, so we'll go with the options. Both are true and R explains A, and both are true, R does not explain A. A is true and R is false, and A is false and R is true. What's the right answer for this question? Right answer for this question, potassium sparing diuretics. Question on potassium sparing diuretics. Yes. Quick answers in the chat box, please. Quick answers in the chat box. Very good. Very good. Yes. So the right answer is right answer is B. Okay, both are true, but R does not explain A. Both are true, but R does not explain A. Okay, so here we can see, yes, just let me go back to the question. Yes, potassium sparing diuretics, they prevent hypokalemia. Absolutely true. Absolutely true. This is an absolute true statement. Potassium sparing diuretics, they prevent hypokalemia. This is why they are used as drugs of choice. These are the drugs of choice in case of potassium loss, especially where loop diuretics and thiazide diuretics fail. Okay, this is the drawback of loop and thiazide diuretics, where they cause potassium loss. Okay, potassium loss, and which leads to hypokalemia. Hypokalemia is the common adverse effect of loop and thiazide diuretics. Okay, but potassium diuretics, they prevent hypokalemia. Yes, this is the assertion is right. And they reduce sodium reabsorption in the collecting duct. Even the reason is right, but this is not the right reason. Okay, this reason does not explain that potassium diuretics, they prevent hypokalemia. Okay, because we can see these loop diuretics and thiazide diuretics also. Even these loop and thiazide diuretics, they also reduce the sodium reabsorption. Okay, they also reduce the sodium reabsorption, but still they cause the loss of potassium. But still they lead to the loss of decrease in the potassium levels. Okay, so yes, both A and R are true, but R is not the correct explanation for A. Okay, so this the prevention of preventing hypokalemia is not because of the sodium reabsorption in the collecting duct. Okay, so moving forward to the next question. Question number 8. Okay, so we have so many questions out there. So I'll give a overall glimpse of the necessary concepts. Okay, next, going to the 4-triamoxazole ratio. Very important question, definitely. So the most probably we'll get a question from cotrimoxazole, some kind of question. Okay, it may be regarding the ratio of trimethoprim and sulfamethoxazole in cotrimoxazole, the effects of cotrimoxazole, the mechanism of action of cotrimoxazole, and the adverse effects, if any, are associated with this cotrimoxazole. All these things. This is the very prominent and most probable question in the upcoming examinations. Yeah. The blood concentration ratio of trimethoprim and sulfamethoxazole after administration in the ratio of 1:5. Okay, so we all know this very well. Okay, this is a very well-known question. The ratio of trimethoprim and sulfamethoxazole in cotrimoxazole. The combination is known as cotrimoxazole. Right, it's the most the sulfonamide combination. Okay, the most prominent sulfonamide combination, whereas trimethoprim and sulfamethoxazole are used in a combination of 1:5 ratio. Okay, but here the question is, when these both are used in a ratio of 1:5, what is the blood concentration ratio? What is the blood concentration ratio? 1:5, 1:1, 1:10, and 1:20. What is the right answer? Is yes, right answer. Many of you answered right. Many of you answered right. Very good. Is D. Okay, so the blood concentration ratio will be 1:20. Okay, so though they are administered in the ratio of 1:5, the blood concentration ratio will be 1:20. Okay, it is 1:20 because this sulfamethoxazole, it has pharmacokinetic differences. Okay, it has a high protein binding. Sulfamethoxazole is a drug which exhibits high protein binding. Okay, so the drugs which has high protein binding, they, yes, definitely they have a synergistic mechanism. Okay, and here these both exhibit a synergistic mechanism, and the drugs with high protein binding, they have an extended therapeutic effect. Okay, they have a extended therapeutic effect due to increased concentration in the blood. As long as this sulfamethoxazole is present bound to the protein, its concentration is, yes, definitely it is high because it is present in the plasma, nothing but the blood. Okay, so it is 1:20. Is the right answer for this question? Yes. Yes, very good. Many of you answered it right. Okay, we'll move with the next question. Now, and we have, yes, very important question about nephrotoxicity. Yes, most probable. That's why I'm repeating this so many times. The most probable questions. Okay, here we have come up with the most probable questions in the GPAT examination. Yes, I also heard from many of my students that today's paper is a little tough. Yes, absolutely. It is a GPAT range question paper. Absolute real-time examination experience-based question paper. Please don't miss out. Don't miss out the discussion, all of you out there. Okay. So match the drugs with kidney structural functional alterations. So various drugs which are associated with nephrotoxicity. Okay. And their mechanism of action, how they are causing this nephrotoxicity. Okay. So just now, as I told you, as the mechanism of action is important, the mechanism of adverse effect is even important. Okay, here the question is about the mechanism. It is not about mechanism of therapeutic action, mechanism of adverse effect. Okay, very important question out there. Yes, we have the aminoglycoside antibiotics, ACE inhibitors, methotrexate, and NSAIDs. All of these drugs, they cause nephrotoxicity. Okay, they cause some kind of drug-induced nephrotoxicity. And what is their mechanism of action? Yes, we will go through once. Okay, we are going through once. Okay, and on list 2 we have glomerular abnormality, tubular epithelial cell damage, hemodynamic mediated kidney injury, and obstructive nephropathy. What is the right answer for this question? Yes, it is A. Okay, the right answer is A. 1B, 2C, 3D, and 4A. Okay, 1B, aminoglycoside antibiotics. As we all know very well, aminoglycoside antibiotics, they cause tubular epithelial cell damage. Okay, they act on the tubule and they cause tubular epithelial cell damage. And ACE inhibitors, they cause hemodynamic mediated kidney injury. Hemodynamics mediated kidney injury, and methotrexate causes obstructive nephropathy, and NSAIDs are responsible for glomerular abnormality. Okay, this is the right answer for the question we have out there. Okay, these aminoglycosides, yes, all as we all know, they cause tubular damage. They accumulate in the PCT. Okay, these aminoglycosides, we all know, they act at the PCT. They accumulate in the PCT. I'm sorry. And they cause tubular damage. Okay, and these AC inhibitors, what they do? AC inhibitors, they block AT2. Okay, again related to the RAS pathway. They are related to the RAS pathway. What they do? They block these AT2, and so by that they cause artery stenosis. So hemodynamic damage, artery stenosis. Here they are causing artery stenosis, which causes reversible rise, immediate rise in the creatinine levels. Okay, immediate rise in the creatinine levels, which is also a parameter of nephrotoxicity. Increase in creatinine, definitely it indicates nephrotoxicity again. Okay, and methotrexate, as we all know, it is a anti-cancer agent. Methotrexate, it causes obstructive damage, obstructive nephrotoxicity. That means they crystallize in the renal tubules. Okay, it is a physical kind of obstruction. And NSAIDs, they cause glomerular abnormality, as we all know very well. They inhibit the COX enzymes. NSAIDs, they inhibit the COX enzymes. COX-1, we all know very, very well. NSAIDs, they inhibit the COX-1 enzyme. They are COX-1, like they are non-selective COX inhibitors, mostly inhibiting aspirin, especially inhibiting COX-1 like this. They are non-selective COX inhibitors, NSAIDs, almost all of them. Okay, and we have our next question related to the physiological solution that is used in the intestine. Okay, physiological solution in intestine. Okay, a question mostly related to human anatomy, physiology, and pharmacology as well. Okay, so we all know the questions from human anatomy, physiology are also a part of this questions in pharmacology. Okay, yes, please. The solution used in the investigation of pharmacological preparation of intestine. Okay, intestinal preparations. Whenever we are going for the investigation of intestinal preparation, what is the right solution? Ringer's-Krebs solution, modified Ringer's solution, and normal physiological solution. Sorry. Yeah, what's the right answer here? Right answer? Yes. Is the Krebs physiological solution. Right answer. Many of you answered right. It is B. Krebs physiological solution. Yes, sir. Yes. So immediately, whenever we see such kind of solutions related to, whenever questions related to solutions, we immediately jump to Ringer's solution. Okay. So it's a common assumption, common physiology, common assumption that we are watching Ringer's solution. Yes. I'm just being there. Okay. This Ringer's solution is not used in the intestinal preparations because Ringer's solution, it lacks the bicarbonate buffer. Okay, it does not contain the bicarbonate buffer. It is used for other solution, like especially which is related to heart kind of preparations, heart and other tissue preparations. This Ringer's solution is used because it lacks bicarbonate. Okay, whereas intestinal preparation, it needs a bicarbonate for its balance. Okay, whereas intestinal preparation, it needs bicarbonate for the proper acid-base balance, which is to be established in this intestinal part. Okay, and coming to modified Ringer's solution. Yeah, modified Ringer's solution again. Yes, it is used. That's what it is used in the cell bath, but not for the intestinal preparations. Okay, it is used for other portions, other physiological portions, especially in heart, in the investigation of heart preparation, in investigation of some other tissue preparations. Okay, Krebs preparation is used for intestine. Okay, so and normal saline. Okay, in normal saline there is no buffer actually. So we know very, very well this intestinal preparation, it needs it as its pH. As we know very well, the intestinal pH is something around intestine, whether it is large intestine or small intestine, it is around a basic pH of 6.8 to 7.4 will be the intestinal pH. Okay, so to balance this pH, definitely it needs a buffer action. Okay, to balance that particular pH, it needs a buffer action. So normal saline, it does not contain, it contains only sodium chloride out there. So it is not suitable for this preparation. Okay, fine. So let me go to the next question. Very, very important question from immunosuppressants. Okay, question from immunosuppressants. Inosine monophosphate dehydrogenase. Inosine monophosphate dehydrogenase is used as a immunosuppressant inhibitor inosine monophosphate dehydrogenase inhibitor, which is used as an immunosuppressant. Yeah, tacrolimus, cyclosporine, mycophenolate mofetil, and azathioprine. What's the right answer? Yeah, all these things actually, this tacrolimus, azathioprine, cyclosporine, all these are used as immunosuppressants. But here the mechanism of action is important. Inosine monophosphate dehydrogenase inhibitor. Okay, what's the right answer? Yes. All my dearest and enthusiastic aspirants, answer for the question. Very, very important. We usually repeat this. The mechanisms of action, the classification mechanisms of action and adverse effects are absolutely important. Any examination point of view, and the right answer is C. It is yes. It's a tough question. Yeah, slightly, but important. Okay. So it is mycophenolate mofetil. Yeah, most of the times it is tough because we don't go through this immunosuppressants and all these things very well. So we concentrate more on ANS, CNS, CVS, and chemotherapy. Okay, most of us do this. Not only you, most of us do this. So try to at least go through the classification of the remaining portions also. Okay, mycophenolate mofetil. It reversibly inhibits the inosine monophosphate dehydrogenase enzyme. Okay, and whereas this tacrolimus, tacrolimus, what it does? It decreases the interleukin transcription. Okay, it decreases the interleukin IL-2 transcription, and cyclosporine, it is responsible. We all know this very, very well about this cyclosporine, the most commonly used drug in most of the tumors and all these things. Okay, immunosuppressant, the most commonly used immunosuppressant, cyclosporine. Its mechanism of action is it decreases the T cell activation. It decreases the T cell activation, and which is responsible to decrease the T cell mediated immunity. So thereby decreasing the T cell mediated immune reactions. And we have azathioprine. Yes, azathioprine, we all know it is a non-selective anti-metabolite drug. Azathioprine, which is an anti-metabolite out there. So the right answer here is mycophenolate mofetil. In the next question, we have the agent that inhibits serotonin uptake among the following. Serotonin, yes, very simple question, as simple as that. A direct question, very simple. The agent that inhibits serotonin uptake among the following is desipramine, maprotilene, fluoxetine, and lobelin. Sorry, yeah, what's the right answer? Agent inhibiting serotonin uptake among the following is fluoxetine. Is a fluoxetine, it is a SSRI. Selective serotonin reuptake inhibitor. Okay, fluoxetine, as we all know, yes, very good. Many of you answered it right. Yes, it is SSRI, selective serotonin reuptake inhibitor. Drug fluoxetine. Okay, so we all know about these antidepressants. Okay, so we all know fluoxetine is a antidepressant drug. It belongs to the class of antidepressants, right? Yeah, and we also have several other antidepressants, and it belongs to this class of SSRI, selective serotonin reuptake inhibitor, fluoxetine. Okay, whereas desipramine, it is a TCA, tricyclic antidepressant. Desipramine is a imipramine, desipramine, all these things, they are tricyclic antidepressants, which are secondary amines. Okay, they also belong to this particular class of antidepressants only. And maprotilene, it is a norepinephrine selective. Now, it is a norepinephrine selective inhibitor. And lobelin, we have, it is not that, it is lobelin actually. It is a lobelin, it is lobelin actually. Okay, and also we have some SNRIs also. So we also have, in the antidepressant classification, we also have some other drugs called as SNRIs. Please do not get, okay, this is the confusing area at this particular point. What happens, it is a little confusing area. It is selective serotonin, SSRIs and SNRIs. Okay, SSRIs and SNRIs. Okay, so SNRI is nothing but selective serotonin noradrenaline reuptake inhibitor. It is not selective serotonin reuptake exclusively. It is serotonin noradrenaline reuptake inhibitors. We also have SNRIs out there. Example is duloxetine. Okay, their names are similar. Okay, fluoxetine, duloxetine, but their mechanism of action is different. Please remember. Okay, duloxetine is a SNRI, where fluoxetine is a SSRI. There. Okay, yes, yeah, and a very important question once again. Okay, please answer, all of you. Please answer your questions in the chat box and your options in the chat box. Very important question once again. Match the neurotransmitter with its primary CNS function. The neurotransmitters and their CNS functions and their respective CNS functions. Yeah, and we have our options are in column 1. We have the neurotransmitters: dopamine, GABA, acetylcholine, and glutamate. And in column 2, we have memory and learning, motor control, inhibitory neurotransmission, and excitatory neurotransmission. Excitatory neurotransmission. What is the right answer here? Right answer? Yes, right answers in the chat box, please. In the chat box. Yeah. Okay, and we have here dopamine, responsible for motor control. Yes, very nice. GABA, very good. So many of them answered. GABA is a inhibitory neurotransmitter, and acetylcholine is responsible for memory and learning, whereas glutamate is excitatory neurotransmitter. Yeah, A2, B3, C1, and D4. Yes, many of them answered the right answer. Many of them answered the right answer. Here, the right answer, it is D. Yeah, okay. Just a moment. Okay. So, yeah, we all know very well dopamine. It is used in motor control. Just now we have discussed that dopamine acts through nigrostriatal pathway and mesolimbic way also. And also GABA, it is an inhibitory neurotransmitter. We know very, very well about GABA. It is an inhibitory neurotransmitter. And that is why most of the times it is the target for benzodiazepines. Okay, benzodiazepines and barbiturates benzodiazepines, they are GABA receptor antagonists. Okay, GABA receptor antagonists, and we have acetylcholine, which is responsible for memory and learning. Okay, memory and learning. Okay, so the degeneration of acetylcholine, it leads to Alzheimer's disease. That is the reason. Acetylcholine receptor degeneration, it leads to Alzheimer's disease, Alzheimer's. Okay, and we have the glutamate, which is a glutamate. We have it is a excitatory neurotransmitter. Okay, and we have the next question. Yeah, very important question once again from the general pharmacology part. We have identify the statement that best describes LD50. The statement that best describes LD50. Okay, what is LD50? Median lethal dose. Okay, so LD50 is nothing but, here LD50, it represents the median lethal dose. Median lethal dose. Yeah, so what does LD50 represent here? A dose at which 50% of the test animals die, a dose at which 50% demonstrate a response, dose at which all the test animals die, and dose at which at least one test animal dies. What's the right answer for this question? Yes, many of you answering right. Yeah, the right answer is option A. Okay, where the dose of the drug at which median lethal dose is the dose at which almost 50% of the test animals, it is lethal to 50% of the test animals. Okay, whereas this 50% demonstrate a response. Option B, it refers to the median effective dose. Okay, it is ED50. Option B, it refers to ED50. Again, it is the median effective dose, and this one describes the median lethal dose. Yes, okay, so this is about the median lethal dose and median effective dose. Yes, we all know this very well. And the ratio, finally, absolutely very, very important again. This ratio of LD50 to ED50, just now we have discussed the median effective dose and the median lethal dose. The ratio between median lethal dose and median effective dose is termed as the therapeutic index. It is known as the therapeutic index. Okay, so very important for classification of the drugs with high therapeutic index and the drugs with low therapeutic index. Okay, the classification and dosing of the drugs, very, very important in drug design and dosage form development. Okay, So the drugs with high therapeutic index are considered as safe. So here we have to remember a very important point about this therapeutic index. Okay, the prime and the most premium point about this therapeutic index, the drugs which have high therapeutic index are considered as safe, are generally considered as safe, and the drugs with low therapeutic index, they have a narrow therapeutic index, they are considered as unsafe. Okay, and the next we have question about angiotensinogen. Select the functions related to angiotensinogen 2. 82 angiotensinogen 2. And in the first option we have cell proliferation, increased sympathetic activity, increased aldosterone secretion, and increased sodium excretion. And increased sodium excretion. What's the right option? Yes, Q and R are correct. R and S are correct. P, Q and R are correct. Q, R and S are right. Yes. What's the right option for this question? The functions related to angiotensinogen 82. 82 angiotensinogen 2. What's the right answer? Yes. Yes, I have some options out there. It is, yes, it is. C, P, Q and R are correct. Very good, very good. Okay. P, Q and R are correct. Yeah. Yes, angiotensinogen, it is related to cell proliferation. Absolutely. Okay. It is related to cell proliferation, and it is also causes increased sympathetic activity. Yes, angiotensinogen, it causes increased sympathetic activity, increased aldosterone secretion, we all know very, very well. So increased renin, angiotensinogen, increased secretion of angiotensinogen, it causes increased aldosterone out there. But it does not increase the sodium secretion, it inhibits the sodium secretion. In fact, this 82, it inhibits the sodium secretion, it causes retention. Okay, it causes excretion. It does not increase sodium excretion. It causes retention of sodium. It increases the sodium retention rather than excretion. Okay, so very important point. This is kind of side effect associated with 82. In fact, it increases sodium retention is a side effect. So it may result in edema. 82 receptor, the drug this angiotensinogen, it results in edema. In fact. Okay, because of this angiotensinogen and increased sodium retention, there is a chance of edema. Okay, so this is about angiotensinogen. And next we have a very important question out there again. Question from kind of poisoning. Okay, we have a question from poisoning type. Okay, so and we have assertion the disulfiram causes aversion to alcohol. Disulfiram, it causes aversion to alcohol. And reason is accumulation of acetaldehyde produces unpleasant effect. It produces some unpleasant effects. And the options here are, for this question, options we have are both are true and R explains A. Both are true and R does not explain A. Whereas C, A is true and R is false. And we have D, A is false and R is true. What's the right answer for this question? Yes, right answer for this question. Disulfiram, it causes aversion to alcohol, and accumulation of acetaldehyde produces unpleasant effects. Yeah? And the right answer is, yes. Right answer is A. Very good. Very good. Right answer is A. So disulfiram, as we all know, the drug used in alcohol dependence. Disulfiram is a drug that is used in alcohol dependence. In treatment of alcoholism, used in alcohol dependence, used in alcoholism, disulfiram, we can call it as an antagonist to alcohol. We can call it an antagonist to alcohol, which causes aversion to alcohol. Okay, so this aversion to alcohol caused by disulfiram, yes, it is because what happens, it inhibits the aldehyde dehydrogenase. Okay, it inhibits the aldehyde dehydrogenase enzyme. So what is the function of this aldehyde dehydrogenase enzyme? It breaks down this alcohol, which breaks down alcohol in fact. Okay, aldehyde dehydrogenase ADH enzyme, it breaks down alcohol. Okay, so by blocking aldehyde dehydrogenase enzyme, disulfiram, what it does, so whenever this alcohol is consumed, what happens? It causes flushing. Due to the blockade of enzymes, there is no hydrolysis, there is no degradation of this, there is no further degradation of alcohol, which leads to accumulation of alcohol, causing flushing, headache. Okay, so we call sometimes hangover. Okay, sometimes we call it as a hangover or something, like when it is accumulated due to the accumulation of alcohol, kind of flushing, headache, hypotension, nausea. So due to all these things, so this may not usually happen, but that is the function of disulfiram. Okay, what it causes? It causes certain dislike towards this alcohol. Okay, due to all these things, due to this flushing, headache, due to this kind of vomiting and all these things, the people, they will develop some dislike towards alcohol. Okay, aversion is nothing but a kind of dislike. Okay, so hatred towards alcohol. So this usually, I don't think the dependence, it is used in dependence, that's what. I don't think this works much. Therapeutically it is right, but I don't know. Usually and socially may or may not be correct. I don't know. The users must know this much better. Right? Okay, the next question. Next question from reproductive drugs acting on the reproductive system. Question from drugs acting on reproductive system. Finasteride acts by inhibiting what? Aromatase, 5-alpha reductase, androgen receptors and estrogen receptors. Androgen receptors and estrogen receptors. Finasteride. It acts by inhibiting what? Finasteride. It acts by inhibiting the, yes, 5-alpha reductase. Very good. Very good. Whoever have answered 5-alpha reductase inhibitor. Finasteride is a drug which is a 5-alpha reductase inhibitor. It inhibits the enzyme 5-alpha reductase which converts testosterone to dihydrotestosterone, which inhibits the dihydrotestosterone. Testosterone to dihydrotestosterone. It blocks this enzyme. It blocks this particular enzyme. So what happens? It reduces the dihydrotestosterone levels by 60 to 70%. 60 to 70%. Okay, and also we have so it is usually used in this particular thing. It is used in prostate related disorders. In prostate disorders. So aromatase inhibitors. So our other options, we have the aromatase inhibitors. Aromatase inhibitor, anastrozole, letrozole, and anastrozole azoles. They are aromatase inhibitors. Anastrozole, the most widely used drug, aromatase inhibitor. And androgen receptor inhibitors, we have flutamide. And estrogen receptor inhibitors, we have the tamoxifen. Okay, tamoxifen and raloxifene, all these things, these are the estrogen receptor inhibitors which are used in this prostate disorders. Next question, we have very important question. Very important question here. Okay, very important question out there. Okay, lactulose is used in hepatic encephalopathy because lactulose, it is used in hepatic encephalopathy because it reduces ammonia absorption, it increases ammonia production, and it inhibits the monoamine oxidase, and it causes diuresis. Yes, what's the right option? Lactulose. Lactulose, it is used in hepatic encephalopathy because of the reason. Yes. Answers please. Yes, it reduces the ammonia absorption. So what usually happens because of in liver failure, in hepatic failure or in liver failure, what usually happens there is an impairment in urea cycle. Impairment in urea cycle where it increases the accumulation of ammonia. It results in the accumulation of ammonia. So ammonia, what happens? Ammonia has a tendency to cross the blood-brain barrier. It easily crosses the BBB. Okay. Ammonia, it usually... Okay. So ammonia, what happens? It crosses the blood-brain barrier. Okay. So due to impaired urea cycle, what usually happens is it results in the accumulation of ammonia. This ammonia, it causes blood-brain barrier. It crosses the blood-brain barrier and leads to encephalopathy. Encephalopathy, that means enlargement. Okay, it's enlargement of astrocytes. Encephalopathy is caused due to the enlargement of astrocytes and neurotransmitter disruptions. Okay, so this lactulose, what happens? It reduces the absorption of ammonia across the blood-brain barrier. It reduces the ammonia absorption and thereby it is used in the treatment of hepatic encephalopathy. Okay, very important question. It's a kind of indirect question. These questions are most probable in your upcoming examination. Okay, and next question we have very important, very easy, most like prominent questions again. The cyclooxygenase isoenzymes COX-1 and COX-2. Okay, we know there are two isoenzymes, many isoenzymes for COX in fact, and the most prominent ones are COX-1 and COX-2. The cyclooxygenase isoenzymes COX-1 and COX-2 differ in they catalyze different pathways. COX-1 is inhibited by aspirin but not COX-2, and COX-2 is inhibited by ibuprofen but not COX-1. COX-1 is constitutive and COX-2 is largely inducible. So what is the difference between COX-1 and COX-2? Yes, what is the major difference between COX-1 and COX-2? Yeah, they catalyze different pathways. No, both of them they catalyze the cyclooxygenase pathway only. Okay, both of them they catalyze same pathway. They catalyze the cyclooxygenase pathway itself. It is inhibited by aspirin but not COX-2. Yes, aspirin it is slightly true, but it is non-selective again. Aspirin being an NSAID, it is non-selective. It is non-selective again. COX-2 is inhibited by ibuprofen. No. COX-2 is inhibited. Ibuprofen does not inhibit COX-2. It is non-selective again, not by COX-1. No, it is not true. It is ibuprofen. It is a non-selective COX inhibitor. Again, and yes, COX-1 is constitutive, whereas COX-2 is inducible. Yes, this is the right answer. Right option is D. Yeah, we have right option is D. COX-1 it is a constitutive enzyme. That means it has a housekeeping function. It has gastric protection. It is consistently it is working. It has a constitutive function, whereas COX-2 it is inducible. It is inducible because of this IL-1. It has because of TNF alpha. Okay, it is inducible in conditions of pain, in conditions of fever, in conditions of inflammation. COX-2 is an inducible isoenzyme, whereas COX-1 is a constitutive isoenzyme. It is mostly stable. Okay, the ratios of COX-1 and the levels of COX-1 are mostly stable. It is a constitutive type of isoenzyme. Okay. So here this is the mechanism. So option D is the right option. Okay, very important. We usually think that we get questions from. So what is aspirin is a type of COX-1 inhibitor, COX-2 inhibitor, non-selective, and select the COX-2 inhibitor among the following. Okay, COX-2 inhibitors. What are the examples of COX-2 inhibitors? Yes, quick answers from all the aspirants. I need quick answers from all the aspirants. COX-2 inhibitors examples. Celecoxib, Rafacoxib. Okay, these are the selective COX-2 inhibitors. Selective COX-2 inhibitors, and we have NSAIDs like profens and diclofenac and all these things which are non-selective COX inhibitors. Yeah, next question we have arrange the events of acute inflammation in proper sequence. Very important question. Inflammation question regarding the inflammation. Acute inflammation, arrange the events of acute inflammation in proper sequence. In proper sequence we have, yes, the fluid retention leading to platelets, to PMNs and to healing. Okay, and we have all these sequence. What's the right answer? We have a various of sequence, series of events. What's the right answer for this question? Yeah, right answer for this question. The sequence of events in acute inflammation sequence, yes, is C. C, that is, okay. So fluid retention, that means plasma exudation. Okay, fluid flow, so which leads to fluid expression, that is plasma exudation, which leads to polymorphoneutrophils, PMNs, that is polymorphoneutrophils. PMN here is nothing but, so PMN is not phenyl mercuric nitrate here. Okay, so the common abbreviation we know in pharmacy for PMNs is phenyl mercuric nitrate, but here it is not phenyl mercuric nitrate, it is polymorphoneutrophils. PMNs are polymorphoneutrophils. It leads to the infiltration of polymorphoneutrophils and which lead to platelet activation, which lead to healing. Okay, in inflammation, the response to inflammation. So this is the sequence of events that occur in case of inflammation. Okay. Okay, and next next we have questions from clinical pharmacology and adverse effects. Very, very important once again. Adverse effects, question related to the adverse effects here. Identify the correct combination. So question from clinical pharmacology, identify the right combination of drugs. Okay, ethosuximide in partial seizures, memantine in Parkinson's disease, naloxone used for opioid overdose, and disulfiram for nicotine dependence. Nicotine dependence. What's the right option? We have correct indication of drugs. Which one of the? So here it is like all these are not right options. There is only one right option of this sequence. What's the right option? Yes. Yes. Quick answers in the chat box, please. Quick answers. Yes. Very good. Yes, the right option is C. Naloxone is used in opioid overdose. Okay, we all know naloxone is a opioid antagonist. Naloxone, it is used in morphine poisoning and all these things. Opioid overdose. Naloxone, it is a opioid antagonist, the most widely used opioid antagonist. And we have the other options here of ethosuximide. Okay, ethosuximide, it is used in absence seizures. It is not used in partial seizures. The drugs that are most widely used in partial seizures are phenytoin and valproate usually. Okay, the drugs used in partial seizures are phenytoin and valproate and not ethosuximide. Ethosuximide, it is used in most widely used in absence seizures. Okay, and the drug of choice in like status epilepticus is, this is also very important. The drug of choice in status epilepticus, we have different types of seizures, right? There are different types of seizures. There is a different classification for seizures like partial seizures and generalized seizures. Okay, we have two types of seizures, partial seizures and generalized seizures, whereas generalized seizures are again further classified into basically the major classification is tonic-clonic seizures and the absence seizures. Okay, generalized seizures, we have two types again, the tonic-clonic seizures and the absence seizures again. Okay, and also we have a condition known as status epilepticus. Status epilepticus, it is a type of epilepsy. It is a condition of epilepsy, or it is a type of epilepsy where the seizures, whereas these seizures, intense seizures, last for more than 15 minutes. Okay, intense seizures which last for more than 15 minutes, and diazepam is the drug of choice in status epilepticus. This is a very important point. Okay, very important point. Diazepam is the drug of choice in status epilepticus, in the treatment of status epilepticus. Okay, and memantine, it is used for Alzheimer's. It is not used in Parkinson's disease. The drugs of choice in Parkinson's disease is usually levodopa and with a combination of carbidopa. Parkinson's disease. Memantine, it is not a drug used in Parkinson's. It is used in Alzheimer's disease. It's an NMDA receptor antagonist. Okay, and also we have disulfiram. Disulfiram, it is used in alcohol dependence, right? We also discussed. It is not used in nicotine dependence. It is used in alcohol dependence. So disulfiram. So the drugs that are used in nicotine dependence are varenicline. Okay, and bupropion. So here the right answer is naloxone is used in opioid dependence, opioid toxicity or opioid dependence. Yeah, next we have a question. Select suitable drug targets for the treatment of pulmonary hypertension. The suitable drug targets for pulmonary hypertension are we have CCBs, calcium channel blockers, PDE3 inhibitors, digoxin, and prostaglandin analogs. So what are the suitable drug targets for pulmonary hypertension? For pulmonary hypertension, yes, it is P, R, and S. Yes. Calcium channel blockers, digoxin, and prostaglandin analogs, whereas PDE3 inhibitors, they are not suitable for pulmonary hypertension. They are useful in acute heart failure. Okay, it is used in heart failure. PDE type 3 inhibitors, they are used in heart failure, and they are not cardiac arrest and heart failure kind of conditions, not in pulmonary hypertension. Okay, so CCBs, just now we have discussed calcium channel blockers and digoxin, prostaglandin analogs. Yes, epoprostenol, etc. Epoprostenol, prostaglandin analogs, they are used in pulmonary hypertension, whereas PDE3 inhibitors, they are used in acute heart failure, not in pulmonary hypertension. Okay, moving forward to the next question. We have take the antitussive agent with a peripheral effect. Very, very important once again. Antitussive agent with a peripheral effect. Okay, codeine, tusuprex, libexine, and glycine hydrochloride. What's the right answer? Okay, here in the first place itself we can exclude codeine. Okay, in the first place we can exclude codeine because codeine CC, it is a centrally acting antitussive. Okay, it is a centrally acting antitussive, very, very commonly known. Codeine, it is a centrally acting antitussive agent, and the right answer here is libexine. Yes, very good, very good. Many of you answered right. It is C, libexine. Okay, whereas all these things, codeine, tusuprex, glycine hydrochloride, they are centrally acting antitussive agents, whereas this libexine is a peripherally acting antitussive agent which exhibits a local anesthetic effect even. Okay, which acts by means of peripheral receptors and exhibits an local anesthetic effect along with antitussive effect. Okay, and the next question we have, insulin causes reduction in blood sugar. Insulin, it causes reduction in blood sugar by which of the following mechanisms? Okay, so in our previous session we were discussing there will be some question. One question is compulsory from insulin. It may be anything. Okay, it may be about the mechanism of action of insulin or the types of insulins we have. Long acting, short acting, and intermediate acting insulins. Okay, it may be from the classification of insulins, mechanism of insulin. Okay, so all these things, there is one question from insulin compulsory, absolutely compulsory. Okay, and we have increased uptake in peripheral tissue, except here. See, watch these statements here. Okay, the captivating words and captivating statements, except increased glucose uptake in peripheral tissue, decreased breakdown of glycogen, decreased gluconeogenesis, and decreased glucose absorption from the gut. Yes, what's the right answer? Right answer is option D. Option D is the right answer. Insulin, it has no effect for the decreased glucose absorption from the gut. Okay, it does not impact or it does not influence the decrease of glucose absorption from the gut. Okay, decreased glucose absorption from the gut, it is taken care by acarbose. Okay, it is taken care by acarbose. Okay, and there are others like peripherally, it increases, yes, peripheral uptake, it has an influence. Decreased glycogenolysis, yes, insulin, it again acts as a reverse pathway. Decreased gluconeogenesis, yes, insulin affects this, but it does not affect the decreased gut absorption, decreased absorption from the gut. The next question we have, match the drug with its adverse effect. Very, 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 very important, the drugs and their adverse effects and the mechanism of adverse effects, some cases. Okay, so here we have drugs are chlorpromazine, phenytoin, lithium, and carbamazepine. Yes, chlorpromazine, phenytoin, lithium, and carbamazepine and their respective adverse effects. What's the right option? Yeah, right option, chlorpromazine. Chlorpromazine causing tardive dyskinesia. Chlorpromazine, it is a kind of atypical antipsychotic. Okay, the most common adverse effects of atypical antipsychotics are the EPS, extrapyramidal effects, tardive dyskinesia, okay, dystonia, all these things, tardive dyskinesia and dystonia. The dystonia, these are all the various kinds of extrapyramidal effects. So chlorpromazine, it is the atypical antipsychotic. Okay, it is the atypical antipsychotic. It leads to tardive dyskinesia. And phenytoin, yes, phenytoin, very important adverse effect of phenytoin is gingival hyperplasia and lithium, which causes nephrogenic diabetes insipidus, and carbamazepine. Most common adverse effect of carbamazepine is agranulocytosis. Okay, so it is A1, B2, C3 and D4. The right answer is A1, B2, C3 and D4. Okay. Okay, so this was about questions from pharmacology so far in today's mock test 2 GPAT 2026 mock test 2, and we will proceed with the questions from pharmaceutics. Okay, we have very beautiful and very prominent important questions from pharmaceutics too. Okay, so hope you all are excited to go with the pharmaceutics part. Very, very important. We all know well. Okay, we all know very well about pharmaceutics. Okay, pharmaceutics occupies a major role in GPAT examination, plays a major role. Questions total a total of 38 questions from pharmaceutics part, from the whole pharmaceutics part. Number of 38 questions again. Yes. So B, I think you all should be, yes, you need to be a little more interactive, little more active. Yes. So the first question from assertion reason. Okay, partition coefficient has no role in oral drug absorption. Question from drug absorption, drug solubility and absorption preformulation. Okay, question from preformulation and drug biopharmaceutics. Partition coefficient has no role in oral drug absorption, and the reason is absorption depends solely on solubility. Solely on solubility. And we have our options are A, both A and R are false, B, A is false but R is true, and C, A is true but R is false, and D, both A and R are true. Both A and R are true. Yes? What's the right option here? Right answer for this question, partition coefficient has no role in oral drug absorption, and absorption wholly depends on solubility. Depends only on solubility. What's the right option for this question? Right answer please. Right answer please. Yes, option A, both A and R are false. Okay, so we usually go with an assumption. Okay, here most of you might you might go with an assumption that we might go with an assumption that mostly with the assertion reason questions, the first option will be A and R are true, and R is the explanation for A. R explains A, and we may have A and R are true. Option B, we expect this. Okay, we expect the same pattern to be followed. Usually we think that the same pattern will be followed all through. Yes, that is not right. Please go through the options before you come to a conclusion. Okay, so we usually go with this assumption. Yes, this is not always right. And here the first option we have is both A and R are false. Yes, both A and R are false. Partition coefficient definitely has a role in drug absorption. Partition coefficient, it indicates drug's lipophilicity. Okay, partition coefficient, it is an indication of drug's lipophilicity. Drug lipophilicity, which relates to drug absorption, which is a prominent part of drug absorption, whereas drug absorption depends only on solubility. No, absolutely wrong. Both are false, in fact. Okay, both of these statements are false. Okay, and we have the next question from pharmaceutics. Yes, according to Stokes' law, the sedimentation rate is directly proportional to. Okay, question from physical pharmacy we have. According to Stokes' law, sedimentation rate is directly proportional to. The sedimentation rate is directly proportional to what? What? Yeah. Yes. Viscosity of the medium, the density difference, temperature, and Brownian motion. What is the right option for this question? Yes, the right answer for this question according to Stokes' law, sedimentation rate is directly proportional to what? Sedimentation rate is proportional to the, yes, very good, it is directly proportional to the density difference. It is directly proportional to the density difference. Here is the equation for Stokes' law. V equals to, okay, according to Stokes' law, the sedimentation rate, okay, V sedimentation rate equals to d square into rho s minus rho 0 into g by 18 eta, where d is the diameter of the particle, and rho s minus rho 0 is nothing but the density difference between the two phases, density difference between the continuous and the discontinuous phases, and g is acceleration due to gravity, and eta is the viscosity. So what all we have here? Viscosity of the medium. No, it is inversely proportional. It is directly. The question is asked about direct proportionality. It is inversely proportional to the viscosity, and it is not dependent on the temperature. Not directly. According to Stokes' law, it is not directly dependent. Okay. Stokes' law does not deal in any way about the temperature affecting the sedimentation rate and the Brownian motion of the particles also not directly related. Here it is related to the density difference. Okay, so sometimes we also may get a question from this part. Okay, some previously asked question. According to Stokes' law, the factor that highly influences the sedimentation rate. Okay, the factor that highly, extremely influences the sedimentation rate. This kind of question is also possible. Okay, so out of all these factors, the factor that highly influences that sedimentation rate is the diameter of the particle. Okay, it has a high influence is the diameter of the particle, because diameter is, it is the square of diameter. This is the square of diameter. Always please remember this small point, this small trick here. Whenever you have square or cube, okay, d square, okay, v cube. So wherever there is a square, cube, or to the power, wherever there is power, okay, the power lies in the power actually. Okay, the power or the effect lies in the power. Okay, wherever there is power, it is the highly influential factor, highly influential parameter, highly influential factor. Okay, here the sedimentation rate, out of all these factors, it is highly influenced by the diameter of the particle, especially because of the power which it carries. Okay, so whenever you come across these questions, please remember this tip, this small tip or this small aspect. Okay, next we have the next question as viscosity measured using capillary viscometer depends on. Okay, viscosity measured using capillary viscometer, it depends on what? Okay, so capillary viscometer is most widely used for. Okay, the common example for capillary viscometer. Okay, one of the common examples for capillary viscometer is the Ostwald viscometer. Okay, the common example for capillary viscometer is the Ostwald viscometer, and these are most widely used for the measuring the viscosity of Newtonian fluids, measuring the flow and viscosity of Newtonian fluids. Capillary viscometers, they are used for the determination of viscosity or determination of flow of this Newtonian fluids or Newtonian liquids. Whereas for non-Newtonian fluids, okay, the viscosity determination is usually made by means of rotational viscometers. For in case of non-Newtonian fluids, yes, this is suitable. The viscometers that are suitable are rotational viscometers. Rotational viscometers are of different types again: cup and bob viscometer and cone and plate viscometers. Okay, we have several others also, but the most prominent ones being the cup and bob viscometers and cone and plate viscometers. Okay, we have this Brookfield viscometer, which is a variant again of the cup and bob viscometer. So Brookfield viscometer is used in the determination of viscosity of non-Newtonian fluids. In the viscosity of non-Newtonian fluids, because it is a variant of cup and bob viscometer. Okay, so the viscosity measured using capillary viscometer, it depends on what? It depends on density only, flow time only, density and flow time both, and temperature only. What is the right answer for this question? Viscosity measurement of capillary viscometer using a capillary viscometer, it depends on what? Yes, it depends on what? Depends on density and flow time both. Okay, both on density and flow time. Okay, because it is dependent on both the kinematic and absolute viscosity. It is a variant of both kinematic and absolute viscosity. So it here by this we can see that it is both density and flow time both are factors that are impacting this particular flow, determination by capillary viscometers. Very important from this part. Okay, especially again, so let me make a mention over here, this rheology and the viscosity and rheology. Okay, there is a high probability of getting at least one or two questions. This is the most It's one of the easiest topics and important topics, rheology and viscosity. Just go for a quick revision, quick review of rheology and viscosity. There is a probability of approximately 1 or 2 questions from rheology and viscosity. Okay, especially based on these parameters, types of viscometers, and types of flow. Because in rheology we have the Newtonian and non-Newtonian flow, types of fluids, all these things. Okay, you all know them very well. And let me go to the next part of question from aerosol propellants. Statement based question once again. The statement 1 is propellant 114 is chemically 1,2-dichloro 1122 tetrafluoroethane. 1122 tetrafluoroethane. And the statement 2, CFCs are preferred over HFCs because CFCs do not deplete the ozone layer. They do not deplete the ozone layer. So what are the options we have here? Statement 1 is true and statement 2 is false. Statement 1 is false and statement 2 is true. Both statements are true. Both statements are false. Yes, what's the right answer? What is the right answer? Yes, please don't make such kind of mistakes. Please don't make this kind of mistakes. Okay, here the right option is A. Right option is A. The statement 1 is true. Statement 1 is true, that is 114 is chemically 1,2-dichloro 1122 tetrafluoroethane. And statement 2 is false. Statement 2 is false because CFCs are not preferred over HFCs. It is reverse in fact. Okay, hydrofluorocarbons are more preferred. Okay, are drugs of choice more preferred over CFCs. Because CFCs they cause the depletion of ozone layer, whereas HFCs they cause less depletion of the ozone layer. The most viable propellants are CFCs for the depletion of ozone layer. Okay, CFCs, chlorofluorocarbons cause more depletion of ozone layer compared to hydrofluorocarbons. That is the reason these days more hydrofluorocarbons are used than chlorofluorocarbons. Okay, so yes, we all know this very well. 114 is 1,2-dichloro 1122 tetrafluoroethane. Yes, question from the nomenclature of propellants is also very probable again, sir. So here I'll just go with a quick review of nomenclature of aerosol propellants. Nomenclature of aerosol propellants, the first digit. Okay, the first digit it indicates in nomenclature of aerosol propellant. The first digit indicates the number of carbon atoms -1, and the second digit it indicates number of hydrogen atoms +1, and the third digit it indicates the number of fluorine atoms. Present in this. So this is suitable for chlorofluoro and hydrofluorocarbons, chlorofluoro and HFCs and CFCs. This nomenclature most widely suitable for the fluorocarbons, chlorofluorocarbons and the hydrofluorocarbons, whereas the first digit it is indicative of carbons -1, second is hydrogens +1, and third one is number of fluorine atoms which are present in that particular molecule. And if we have any suffix, if we have any suffix like A, B, C, D, etc., the suffixes of A, B, C, D, etc., they indicate the asymmetry of the molecule. Okay, so when there is no suffix, okay, for example, we have 114, no suffix. Okay, no suffix, it indicates the molecule is completely symmetric. No suffix, it indicates the molecule is completely symmetric. And if we have A, it is slight decrease in the symmetry, slightly less symmetric. The B, more less symmetric. C and D. So as the alphabet increases, the symmetry decreases. The symmetry of the molecule decreases. Okay, so this is about the nomenclature of propellants. And if we have anything like C, okay, anything like small alphabet C as a prefix, C as a prefix, it indicates the molecule is a cyclic molecule. If it is a C in the prefix as a suffix, it indicates asymmetry. The C as a prefix, it indicates the molecule is a cyclic molecule. Okay, so this is about the nomenclature of propellants as a quick reference. Okay, moving forward to the next question we have. Very important question from coating again. Sugar coating increases tablet weight approximately by. Simple question, very simple question, but important. Sugar coating increases the tablet weight approximately by A 5 to 10%, B 10 to 20%, C 30 to 50%, and D 60 to 80%. Yes, your right answers in the chat box, please. Sugar coating increases the tablet weight approximately by what? Yes, approximately by 30 to 50%. Yes, many of you answered right. Very good. It increases by 30 to 50%. Because we can see the sugar coated tablets. Okay, we can see sugar coated tablets, especially the most standard example of sugar coated tablets are the multivitamin tablets we have. Okay, the most standard example is the multivitamin tablets like B+4, Supradin, all these things with the different brand names. The multivitamin tablets, most standard example of sugar coated tablets. We can see the tablet weight is high. Okay, we can see the tablet weight is high. Okay, and the sugar coating in tablets. Yes, sugar coating in tablets. It involves several steps. Okay, several steps like sealing, subcoating, smoothing, coloring, and polishing. Okay, these steps are also very important again. No, it increases by 30 to 50% in fact. Okay, so we have various things like sealing. Yeah, sealing, we have various steps like sealing. Sealing, it is done by to prevent it is okay. It is 50 to 100%. In book, it is 50 to 100%. Okay. Yeah. Okay. So we can consider 50 to 100% if the option is 50 to 100%. Yes, we can consider that. Okay, there may be slight mistake in this. Yeah, there may be some mistake. Okay, no worries. Okay, and we will see the steps of sugar coating also very important, and ingredients which are responsible for this. Sealing, it is done usually to prevent the entry of moisture. Sealing step is done to prevent the entry of moisture, usually done by means of shellac, zine, etc. Shellac and zine are used for this step, sealing. In subcoating, yes, subcoating, it is done by syrups, usually syrups and powders. Usually subcoating is done by syrups, and smoothing by some titanium dioxide or this kind of smoothing elements. Coloring, using coloring agents, and polishing by means of certain waxes. And here this increase in the, so this is also important. Which step of sugar coating is responsible for increasing the weight of tablet? This is also an important question, probable question. Which step? Here we have seen various steps of sugar coating, right? Yes. Yeah, definitely. There was certain mistake in the question. Don't worry. Such type of questions, yes. If there is a mistake in the question, definitely you can choose that option. Yes, which step? Yeah, sealing is known as waterproofing. So which step of these, out of sealing, subcoating, smoothing, coloring, and polishing, which step is responsible for increased tablet weight? Increase in the weight of tablet. This increase in the tablet weight due to sugar coating is due to which step out of all these things? Which step causes increase in the weight of the tablet? Subcoating. This is also very important. Subcoating step is responsible for increase in the weight of the tablet. Increase in the overall weight of the tablet. Very good. Some of them answered this question as subcoating is true. Right answer. Okay, and next we have a question from pharmaceutical engineering. Flow of fluids. If pipe diameter is doubled, volumetric flow rate or the laminar flow or the volumetric flow rate increases by. If the pipe diameter is doubled, yes, the volumetric flow rate is increased by 2 times, 4 times, 8 times, or 16 times. 8 times, 16 times. Yes. The right answer for this question in flow of fluids. Question from flow of fluids. If the pipe diameter is doubled, yes, it increases by 16 times. The flow rate increases by 16 times. The volumetric flow rate, it increases by 16 times because, see, according to Hazen-Poiseuille's equation, so what it is showing, the diameter, it increases. It is to the power 4. Just now I told you, wherever the impact lies in the power. Okay, for whatever it is, whatever it may be, any parameter or anything, any physiological or any psychological, anything, the impact lies in the power actually. So when you have power, you have impact, definitely. Okay, so please remember, impact lies in the power. So it has power, this diameter, it has a power of 4, high power, highly powered, power of 4. So what happens when the diameter is doubled? When the diameter is doubled, what happens? 2d, it becomes 2d to the power 4. That means it is 16 time increase. It is a 16 time increase. Okay, very important question from pharmaceutical engineering and flow of fluids. Okay, so next question from pharmaceutical engineering again. Yes, and current heat exchangers, counter current heat exchangers are preferred because are usually preferred because they are cheaper, they provide higher temperature driving force, they occupy less space, and they reduce fouling. Yes, the right option is right option is option B, they provide higher temperature driving force. Counter current exchanges, heat exchangers, that means, see here, counter current exchange happens, is the reciprocal exchange. Counter current is nothing but the reciprocal heat exchange, and here what happens, they provide a, yes, very good, they provide a higher driving force of temperature, higher temperature driving force. Okay, so that is the reason counter current heat exchangers are more widely preferred. And here we have another question. Identify the excipients used as alternative for gelatin. Alternative to gelatin for capsule cells. Question from capsules. Yes. Identify the excipients which are used as alternative to gelatin for capsule cells. So we all know usually capsules are made of gelatin. Okay, usually the capsules are of different types. Hard gelatin capsules and soft, mostly made of gelatin. Usually made of gelatin, but because of certain restrictions like IAEC guidelines and all these things to reduce the animal harm. Okay, to reduce the harm to animals, because gelatin it is derived from animals, to reduce the taste. We are going for alternatives and also for increased vegan population. Okay, we have HPMC, hydroxypropyl methyl cellulose, pullulan, starch. What's the right answer? 1 and 2, 2 and 3, 1 and 3, 1, 2 and 3. 1, 2 and 3, yes, right answer. Yes, it is 1, 2 and 3, yes. All the three, HPMC, hydroxypropyl methyl cellulose, pullulan. Pullulan, it is a natural polysaccharide. Pullulan is a natural polysaccharide which is obtained from a fungus. Okay, it is obtained from a fungus. So it is known as Oreobasidium pullulans. Okay, so it is a polysaccharide obtained from, natural polysaccharide obtained from this particular fungus, which is used as a substitute for gelatin in the manufacture of capsules. And also starch, yes, modified starch is also used in the starch capsules are also available. Yes, so it is used as an alternative. The right answer is 1, 2 and 3. Okay, next question from pharmaceutical engineering once again. Basket centrifuge operates on the principle of. Question from centrifugation. Basket centrifuge operates on the principle of sedimentation under gravity, filtration under centrifugal force, diffusion and absorption. Basket centrifuge, it operates on the principle of what? Of what? Yes, filtration under centrifugal force. Very good. See, you can see here directly, even if you are not sure. Okay, even if you are not very much sure about this particular question, you can just devise from the options. Okay, you try to conclude from the options. Filtration, basket. Okay, here you have basket and filtration, which are very much related. We use baskets for filtration, right? Basket, it is very much related to filtration. If so, so like a blind conclusion, not exactly like a blind conclusion. Sometimes if you are 60% probable, yes, you can take this chance. Basket, it is used for filtration, to remember. I'm just saying this for remembrance purpose. It is not a hard and fast rule, just for remembrance. We can just conclude that. You can just decode Yeah, filtration under centrifugal force is the right answer for basket centrifuge. Okay, it operates on this particular, the perforated, it has a perforated basket which filters under this centrifugal force. Okay, we all know, because centrifugation, it is also a type of separation procedure. Centrifugation, it is also one of the types of separation procedures. Okay, and next question we have question from pharmaceutical engineering once again. Okay, we have some questions from pharmaceutical engineering. Okay, the most probables. Secondary drying in lyophilization of pharmaceuticals removes. Secondary drying in lyophilization of pharmaceuticals removes what? Free water, B bound water, C ice crystals, and D solvent vapors. Solvent vapors. What's the right answer for this question? Lyophilization. Very good. So what is lyophilization? The other name for lyophilization is freeze drying. Okay, the other name for lyophilization, yeah, freeze drying. It includes several steps. Okay, this freeze drying or lyophilization includes several steps. Okay, so the first step, which includes freezing, that means conversion of this free water to ice crystals, removal of free water. First, primary drying. Okay, primary drying, which includes freezing, and then primary drying, removal of free water, and secondary drying, which removes the bound water, internal water. Okay, this is the surface. Primary drying is the surface drying. Primary drying is the surface drying, removes only the free water, and secondary drying is the internal removal. Okay, removal of the adsorbed bound water, which are present in the molecule. Okay, that is secondary drying. Okay, so these are the various steps in the freeze drying or lyophilization procedure. Okay, next question from novel drug delivery systems. In TDDS, reservoir systems differ from matrix systems in terms of which have no coating, contain drug in the core surrounded by polymer membrane, and are always tablets, are contained for immediate release. Reservoir systems differ from matrix systems in terms of, yes, containing drug contained in a core surrounded by membrane. Drug is contained. So reservoir, the name itself indicates in TDDS there are different types of systems, reservoir and matrix systems. Whereas transdermal drug delivery systems, TDDS, okay, reservoir systems means the drug is contained in a core reservoir. Okay, the drug is contained in a core reservoir which is surrounded by a polymer membrane. Whereas matrix systems, which consists of the drug which is dispersed uniformly in the matrix. Okay, matrix systems, whereas the drug which is uniformly dispersed in the whole matrix. Okay, so this is the major basic difference, that is the drug is contained in a core surrounded by a polymer membrane. Okay, so this is the reservoir type. Next question. Okay, we'll move a little faster. Match the polymers with their chemical nature. Question from polymers, very important again, with their chemical nature. Okay, this is like transdisciplinary questions. Okay, transdisciplinary questions. These are most probables again. Cytosine, sodium alginate, carbopol, and HPMC. Anionic polysaccharides, cationic polysaccharides, non-ionic cellulose derivatives, and synthetic cross-linked acrylic acids. Okay, what's the right answer? Yeah, the right answer is B. The right answer is option B. Yeah, yes. Cytosine is a cationic polysaccharide. Cytosine, it is a polysaccharide which is cationic polysaccharide. Alginate, please remember. CC, cationic. Cytosine is a cationic polysaccharide, whereas alginate is an anionic polysaccharide. Both are polysaccharides. Alginic acid and carbopol. Alginates and carbopol both are polysaccharides, whereas A for anionic, alginate is an anionic polysaccharide, and cytosine is a cationic polysaccharide. And carbopol, it is a acrylic acid. Okay, carbopol, it belongs to cross-linked acrylic acid polymer, and HPMC, it is a non-ionic cellulose derivative. Yeah. Yes, sir. Next we are going with the sterilization. Match the sterilization parameters. Okay, question from sterilization. Match the sterilization parameters. D value, Z value, F value, and SAL. Yes. And they are related to what? Related to, yes, the right option is option A. D value. D value is related to the microbial death rate. D value is related to the microbial death rate. Okay, so we usually calculate D value as the time required. Okay, the time required for the reduction of 90% of the microbial population. The time D value, it is the time required for the reduction of, these all are indicative of what? These are all the indicative of the efficiency of this sterilizing agents. Okay, efficiency of the sterilization procedures and sterilizing agents. Okay, the efficiency of sterilization. So the time required to reduce microbial population by 90%, microbial death rate. Okay, so when we go for the time and death rate curve, yes, please don't go fast. Okay, no, actually, like, we have so many things. Yes, I'll go at a medium pace. Okay, no worries, I will go at a medium pace. Thank you. Yeah, and the Z value is about the temperature sensitivity. Z value is about the temperature sensitivity. Very, very, very important question this is, both from the microbiology point and my biotechnology point of view, and from the pharmaceutics point of view. Okay, they are a part and parcel, in fact, in pharmaceutical parameters. The Z value is that the tenfold decrease in the D value. Okay, Z value, it is not directly related to Z value, it is not directly related to the thermal death rate. When we go across this thermal death rate curve, it is not, Z value is not directly related to the thermal death rate. It is indirectly related. How is it indirectly related? It requires the temperature change. Z value is about temperature. D value is the time. Okay, D value is the time. Okay, the temperature that is changed, that is required to produce tenfold change in the D value again. Okay, this Z value influences the D value, whereas D value directly influences the thermal death rate. Okay. Yes, and going to F0 value. F0 is the sterilization time, equivalent sterilization time. Okay, equivalent time, the time at 121 degrees centigrade to achieve the desired level of sterilization. F0 value, and we have the SAL, very important SAL again. Sorry. Okay, very important SAL again. Okay, SAL is the sterility assurance level. SAL is nothing but the sterility assurance level, which indicates the probability of non-sterility. The complete, all of these D value, Z value, and F value, all of them together also, they do not indicate the probability of non-sterility, whereas the sterility assurance level usually it is 10 to the power minus 6. 10 to power minus 6, that it is non-sterility. The indication of non-sterility is seen when the SAL value is 10 to the power minus 6. Okay, so this is about the sterility assurance and the sterilization parameters. Very important. As sterilization is important, the parameters of sterilization are also equally important. Okay, I'll go at a medium pace, no worries. Okay, next we have questions from pharmaceutical packaging. Okay, read the statements about pharmaceutical packaging. Yes, type 1 is borosilicate glass, type 2 glass is treated soda lime, type 3 glass is suitable for aqueous parenterals, type 4 NP glass is suitable for oral preparations only. Okay, which of these is correct? Which of these statements is correct? Out of this, in packaging, which of these statements will be correct? Yeah, type 1 is borosilicate glass, correct. Type 2 is treated soda lime glass, again right. Type 3 glass is suitable for aqueous parenterals, no, wrong. It is not suitable for aqueous parenterals. Type 3 glass, as we all know, type 3 glass, it is regular soda lime glass. Regular soda lime glass, type 3 glass is regular soda lime glass, yes, which is not suitable for aqueous parenterals. It is suitable for non-aqueous parenterals. Non-aqueous parenterals, especially oily suspensions, emulsions, kind of preparations, is suitable for non-aqueous parenterals. Okay, suitable for non-aqueous parenterals. Most probably for oily injections and all these things, are stored in a type 3 glass, because if it is a regular soda lime glass, what happens? It undergoes, it releases the alkali. What happens? It causes release of alkali. Regular soda lime glass, its feature itself is it releases alkali. Okay, whenever it releases alkali, if it is an aqueous parenteral, yes, it undergoes degradation. Okay, it is suitable for degradation. It is suitable for non-aqueous parenteral. So statement 3 is wrong. And type 4 NP glass is suitable for oral preparations only. Yes, it is right. It is mostly suitable for oral preparations. Type 4 is not suitable for parenteral. It is mentioned clearly, non-parenteral. NP is nothing but non-parenteral glass. Okay, so 1, 2 and 4 are correct, not suitable for parenteral. Parenterals is right. So type 3 is not suitable for aqueous preparations. It is suitable for non-aqueous preparations. Next question from physical pharmacy: match surfactant with its HLB range. Very important question. Match the surfactants with its HLB range. Okay, span 80, tween 80, sodium lauryl sulfate and polaxamide. Okay, high HLB, that is oil in water, low HLB, water in oil, anionic surfactants and non-ionic block copolymers. Yes? What's the right answer here? Yes. Yeah. The right answer is option A. Option A. Span 80. Okay. Span 80 it is. Span 80 is nothing but sorbates. Okay. Spans are sorbitans or sorbates. We call them sorbates or sorbitans. Sorbitan mono-oleate. 80 is oleate. So we all know this. Okay. We will see that a little later. Okay. Span 80 it is a water in oil surfactant. It's a water in oil surfactant. It has a low HLB value. Water in oil surfactants, they have a low HLB value, and tween 80 they have high HLB value. Tween 80 it is polyoxyethylene, polysorbate, polyoxyethylene monoolate, which is usually used in oil in water emulsions. It is a hydrophilic one. It is a hydrophilic, high HLB value hydrophilic surfactant. Okay, and SLS is a anionic surfactant, very important, very prominent. SLS is an anionic surfactant, whereas polaxamide is a non-ionic block copolymer. Okay, whereas polaxamide is a non-ionic block copolymer. Okay, so this is the answer, and here we have regarding these tweens and spans. Okay, tweens and spans. Tweens are regarding tweens and spans, a little explanation about tweens and spans. Spans are sorbitan esters. Spans are sorbitan esters, whereas tweens are polyoxyethylene sorbitan esters. Tweens are polyoxyethylene sorbitan esters, whereas spans are sorbitan esters. Okay, which are indicated by, so the esters which are formed, the esters are formed by linking with the fatty acids, with various fatty acids. So we have to remember this sequence LPSO. I usually repeat this so many times. Okay, LPSO 20, 40, 60 and 80. 20, 40, 60 and 80. The numbers are L is laurate, P for palmitate, S for stearate and O for oleate. Okay, so tween 20 will be polyoxyethylene sorbitan monolaurate. Okay, so this is the sequence. I think we'll move to the next question. We have so many questions out there have to discuss. Okay, the drug excipient interaction leading to eutectic formation. Okay, the drug excipient interaction which leads to the formation of eutectics, which lead to a eutectic mixture formation, mainly affects what? Mainly affects bioavailability, melting behavior, taste, color. Taste and color. Yeah, what is the right option? The drug excipient interaction which lead to the eutectic mixture formation. Eutectic mixtures, it mainly affects what? Yeah, mainly affects the melting behavior. Okay, eutectics is about the melting behavior. So when the drug, so what is a eutectic mixture? Okay, what is a eutectic mixture? They interact at a temp. So when these are eutectic mixture is when the mixture of substances, they are when individual substances they are mixed together, there is an effect with their melting point. Okay, they melt at a temperature lower than the single component. They melt at a temperature, their melting point C. This is the melting point of A and this is the melting point of B. Okay, but in the eutectic mixture, when both are mixed, when A and B are mixed, what happens? The resulting component, the resultant eutectic mixture, it will have a melting point lesser than both of them. It will have a melting point lesser than both of them. Okay, so this is about the eutectic mixture. So eutectic mixture formation, it leads to decrease in the melting point, or which affects the melting behavior of the component. Okay, next we have question from the pH partition hypothesis. Very important question from pH partition hypothesis. pH partition hypothesis explains drug absorption based on what? Based on what? Solubility, ionization and lipophilicity, protein binding and metabolism. pH partition hypothesis is associated with ionization and lipophilicity. That was a direct question, in fact. Okay, pH partition hypothesis, it is associated with ionization and lipophilicity. Okay, it states that the drug's absorption, it is completely related to the whether the drug is in ionized form, depending upon the ionization and lipophilicity of the drug. Okay, pH partition theory, pH partition hypothesis, it states that the absorption of drug is maximum, the absorption of drug is maximum in its unionized form and lipophilic form. Unionized and lipophilic form. The absorption of a drug is maximum when it is in a unionized and lipophilic form. Okay, so this is very important in case of drug absorption. pH partition hypothesis, it explains the ionization and lipophilicity as its factors. Okay. Next, very important question from excipients again. Okay, excipients of parenteral excipients. Very important question. So we usually assume that they will ask, one of the following is an antioxidant used in parenterals. Okay, not only knowing whether it is an antioxidant or preservative, we also have to know the class of antioxidant, the class to which it belongs to. Yeah, we have BHT, the butylated hydroxytoluene, sodium metabisulfate, EDTA, ethylene diamino tetraacetate, and ascorbic acid. Their categories are chelating agent, oil soluble antioxidant, water soluble antioxidant, and reducing agent. So the classification, the type of classification of drugs, yes, it is BHT. BHT, it is a oil soluble antioxidant, butylated hydroxytoluene and butylated hydroxyanisole. BHT and BHA are the most widely used antioxidants in parenteral preparations mostly. Okay, so these what it does, it prevents oxidation in lipid based formation. This is the oil soluble antioxidant BHT. And here we have sodium metabisulfate. It is a water soluble antioxidant. Okay, we have sodium metabisulfate, which is a water soluble antioxidant, mostly used in aqueous parenterals. And BHT and BHA used in lipid based oily parenterals. Okay, oily, you are confused with options A and D. Okay, no worries. Okay, EDTA. So in that case, what you do, you first go with EDTA. Because EDTA is a chelating agent. This is a universal ground rule. We all know it so very well, right? We all know very well about EDTA. We can't leave all these things, but you focus on EDTA. EDTA is a chelating agent. We all know very well. It is a complexing agent through chelation. It works through chelation. Yes. And ascorbic acid is a reducing agent. Okay, ascorbic acid, it is a reducing agent. Vitamin C, ascorbic acid, it functions as a reducing agent. Okay, so here we have the option A. Right. Next question from aerosol propellant gases. Okay, nitrogen is used when a foam type product is desired. Nitrogen gas is used when a foam type is desired, product is desired. Carbon dioxide and nitrous oxide are used when a fine mist is required, but provide less pressure stability as the product is used. Okay, on usage, what happens? Carbon dioxide and nitrous oxide, they are saying that a fine mist is required. When fine mist is required, but it reduces the pressure. Okay, they have a reducing pressure. They don't have a very standard pressure. So, what's the right option for this question? Statement 1 is false, but statement 2 is true. Yes, statement 2 is absolutely true. Carbon dioxide and nitrous oxide are used when fine mist is required. So when the aerosol product is has to be dispersed or has to be delivered in the form of fine mist, what we use is carbon dioxide and nitrous oxide. They are very suitable for this mist type. But what happens? They have a reduced pressure. What happens on certain usage? On certain usage, they get reduced. The pressure is not constant. Okay, the pressure is not constant, as is with the other type of gases. As whereas these chlorofluorocarbons, what happens with these chlorofluoro and hydrofluorocarbons? The pressure is constant. With these type of propellants, what happens? The pressure is constant. Okay, that is their advantage over these compressed gases. The advantage over compressed gases with that of the carbon propellants. Stable, they are stable. They release they provide a constant pressure. Okay, stage so nitrogen, it does not produce foam. In fact, okay, it is also stream. It produces as a fine stream, usually spray. In spray type of aerosols, nitrogen is used. It is a halogen. In fact, it's not completely halogen. It is an inert. Nitrogen is an inert gas. Okay, so it does not produce foam. So that is the reason nitrogen is not suitable. It is not for foam type aerosols. Whereas yes, 2 is true. Okay, so I will go with the next question. Which polymer is commonly used as a viscosity enhancer in ophthalmic preparations? In ophthalmics, viscosity enhancer. Which of the following is a viscosity enhancer? Gelatin, sodium alginate, methyl cellulose, and polyethylene glycol. Can you get this slide share? Definitely. If you are in one of our, if you have downloaded our app, have you downloaded our mobile app? And yes, it is free to download. You have the links in the description box. In the description, yes, if you have downloaded our mobile app, you can get this slide share for free. Yes, you can go through this slide share. We will upload the slide share. By tomorrow morning, you will get this slide share in our mobile app. On our mobile app, in a downloadable format again. Okay, in an absolutely downloadable format, absolutely for free. Yes. So which polymer is commonly used as a viscosity enhancer? Methyl cellulose. Okay. See, here we are avoiding gelatin and sodium alginate. See, gelatin and sodium alginate are also viscosity enhancers, but here we are avoiding it. We are avoiding them because gelatin and sodium alginate are natural and semi-synthetic. They are natural polymers. They have a natural polymers, and ophthalmic preparations, they are to be completely free of microbes. Okay, they have to be completely antimicrobial. They have to exert an antimicrobial action, and they should be completely free of microbial population. That is the reason usually methyl cellulose is widely used as a viscosity enhancer in this viscosity enhancer in the ophthalmic preparations. Okay, moving forward. Bacterial endotoxin detection. Question from bacterial endotoxins. One of the following tests is specifically performed to detect the bacterial endotoxins in parenteral preparations. Question from parenterals again. Sterility test, rabbit pyrogen test, limulus amoebocyte lysate test, and preservative efficacy test. The test which is specifically performed to detect bacterial endotoxins in parenteral preparations. Bacterial endotoxins, yes? What's the right answer? Right answer for this question is option C. Yes, LAL test. Very good. Many of you answered. Okay, LAL test, that is limulus amoebocyte lysate test. Okay, so we all know very well pyrogens. So even LAL rabbit pyrogen test is also suitable, but LAL test is most specific. It is more specific because we all know very well that pyrogens rather than bacteria. They are not bacteria. Pyrogens are not bacteria. They are the byproduct of bacterial reproduction and metabolism. They are the byproducts actually. Pyrogens, they are bacterial endotoxins. Okay, they are the endotoxins of bacteria, especially gram-negative bacteria. Again, okay, especially the endotoxins of gram-negative bacteria. They are the endotoxins of gram-negative bacteria, pyrogens. They are the lipopolysaccharides and endotoxins from gram-negative bacteria. And LAL test, it is limulus amoebocyte lysate test. So what happens in this? We usually use this LAL reagent. Okay, LAL reagent, limulus amoebocyte lysate, which is obtained from the blood cells. Obtained from the blood cells of a horseshoe crab. Horseshoe crab, that is Limulus polyphemus. Okay, that is Limulus polyphemus. So what happens whenever this this has a reactivity towards the bacterial endotoxins? Whenever this reagent reacts with the endotoxins, if endotoxins are present in the preparation, whenever it interacts with this reagent, it forms a gel. Okay, it forms a gel or clot. It immediately clots or it forms a gel. Okay. So by this we can identify that yes, pyrogens, that are nothing but bacterial endotoxins, are present in this particular formulation. So it is more convenient than the rabbit pyrogen test. Okay, so it is more advanced and more convenient, more specific than the rabbit pyrogen test for the detection of bacterial endotoxins. Yeah. Next question. Which WHO climatic zone corresponds to hot and humid climate relevant for stability testing of parenterals? Stability testing of parenterals. Which WHO climatic zone corresponds to hot and humid? Hot and humid zone. Zone 1, Zone 2, Zone 3 and Zone 4. Yes. So in response to this ICH guidelines for parenteral preparation and evaluation. Okay, according to the ICH guidelines of parenteral preparation and evaluation, yes, we have 4 WHO and ICH guidelines. We have 4 zones. That is, zone 1 is temperate zone. Okay, zone 1, which is a temperate zone. Zone 2 is subtropical or Mediterranean zone. Zone 2 is subtropical. Zone 3 hot and dry, and zone 4 is hot and humid. Okay, zone 4 is hot and humid. Okay, so India comes under which of these zones? India falls under which of these zones? Zone 1, 2, 3 and 4. According to this WHO ICH zones, out of all these, India falls under which zone? India is under 1, 2, 3, 4. Which of these? Yes. India is under which zone? Come on, all of you. It is under zone 3. Okay, India is under zone 3. In fact, it is under zone 3. What happens? What's the... One moment, please. Sorry, let me go. Okay. Next, nitrostat is an example of controlled release tablet, bolus tablet, sublingual tablet, or effervescent tablet. That was a direct question. Nitrostat is an example of controlled release, bolus, sublingual, or effervescent tablet. Nitrostat is an example of sublingual tablet. Nitrostat consisting of glycerin, nitroglycerin. Nitrostat is a sublingual tablet which consists of in the treatment of angina pectoris. Okay, it is used in the treatment of angina pectoris, which consists of nitroglycerin or glyceryl trinitrate. Consists of a drug glyceryl trinitrate or nitroglycerin. Yes. Okay, next question. During the compression of tablets, dwell time refers to. See, this is important question. This question was repeated for 4 times in GPAT examination till now. Okay, as on date, this question was repeated Question from tablet compression, compaction and consolidation. Okay, a question from compression, compaction and consolidation, where we have various Haeckel's plots and all these things. During compression of tablets, the dwell time refers to it was repeated 4 times in GPAT examination, even in 2020, 24 probably. Okay, and previous papers also. The dwell time refers to time taken for tablet ejection, time the time for which punches remain at a maximum penetration under compression rollers, time for dye filling, and time for tablet coating. What is this? What is the right answer? Dwell time. Dwell time. Yes, right answer. Many of you answered it right. The time that punches remain at maximum penetration. Dwell time is nothing but the time in which both of the punches, both of the upper punch and lower punch, where this upper punch and lower punch, they remain in contact with each other. They remain at a maximum penetrative stage into the dye cavity. What happens during these punches? What happens? There is a very minimum distance between the upper and lower punches. They remain in maximum penetration effect into the dye cavity. Okay. So it is very critical because it affects the tablet hardness, porosity, and bonding. Okay. So more dwell time causes more particle bonding. More dwell time results in harder tablets. The dwell time is more, it results in hard tablets. More harder tablets. That means more stronger tablets, in fact. Okay. So this is about the dwell time of in tablet compression. Very, very important. Once you go through the tablet compression, compaction, and consolidation also, you just go with the force displacement curves. Okay, the force displacement profiles and the Haeckel's plots. The stages in which there is plastic deformation, there is breakage, and all these things. Okay, you just go with the steps of the tablet compression, compaction, and consolidation. It is very, very important. The Haeckel's plots, type A, type B, type C, there are different Haeckel's plots. The stages, these are very important. Just go through one quick glance. At this moment, I'm just giving you what are the important things you need to go with a quick glance at the final moment. Okay. Next question. Zeta potential is defined as the potential difference between. Zeta potential is defined as the potential difference between the surface of the particle and the dispersion medium, stern layer and the bulk liquid, slipping plane and the bulk liquid, electrical double layer only. So zeta potential is defined as zeta potential is electrokinetic potential. Please remember, zeta potential is nothing but it is the electrokinetic potential. Kinetic potential which is measured at the slipping plane and the stationary layer. It is between the shear plane also known as the slipping plane. Between the shear plane and the boundary layer. Shear plane and the boundary layer. Electrokinetic potential. Remember, zeta potential is the electrokinetic potential, whereas we have the Nernst potential, which is the electrodynamic potential. We have two types of potential in this electrical double layer. We have different types of potential, again surface potentials and potential and all these things. But these two are important, which are electrokinetic is the zeta potential and Nernst potential, which is the electrodynamic potential. Electrodynamic also known as the Stern potential. That is the difference between the stern layer and the bulk. Okay. Yeah. So zeta potential value, usually if the zeta potential value is high, it indicates a greater stable emulsion. It indicates a stable emulsions, more emulsions with good stability. Okay. Next question from emulsions we have. Microemulsions differ from conventional emulsions because. Direct question, simple question. Conventional emulsions because they are thermodynamically stable, they are highly viscous, they are opaque and difficult to prepare. How they are different from the conventional emulsions? Yes, the right option is option A. They are thermodynamical. See, emulsions are thermodynamically unstable preparations. thermodynamically unstable preparations except microemulsions. Except microemulsions are thermodynamically stable preparations. Okay, they are thermodynamically stable, and usually they are not opaque. They are clear. Microemulsions are clear. They are transparent in nature. They are not, usually emulsions are milky in nature, opaque and milky nature. Whereas these microemulsions, they have a transparent look, transparent nature. Okay. Next important question from coating: compression coating. Okay, compression coating, we have various types of coating, like film coating, sugar coating, and along with that compression coating. Compression coating is mainly used to improve the appearance, separate incompatible drugs, increase the hardness, and reduce friability. Compression coating, it is used for what? Which purpose? What is its main purpose, in fact? Yeah, is to separate the incompatible drugs. Okay, compression coating, it is usually performed to separate the incompatible drugs. Separate incompatible drugs. It is B. Now, tablet compression is different from compression coating. Please remember, tablet compression. So, yeah, immediately as we see this statement of like the word compression, we usually go with an assumption that compression means it is a kind of hardness increasing procedure. No, it is not always correct, not always right, because compression coating here, what it does, it separates the incompatible drugs. That means you are individually coating. Okay, you are using a compression coating to separate, individually coating the incompatible drugs. Individually coating the incompatible drugs to reduce the incompatibility between those two particular drugs. Okay, compressing, that means an outer layer. Okay, an outer layer is coated with some compression agent, to prevent its incompatibility with the other drug which is used in the same formulation or same preparation. Okay, so this is used to separate the incompatible drugs is the right answer. Next question, a question for yes, two-layer drugs. Usually, two-layer drugs are also used for incompatible drugs, and compression coating is also. So there are many techniques which are used to use it for incompatible drugs. Okay, out of this, compression coating is one of the procedures. Compression coating, it is one of the procedures. It isolates two drugs. It isolates the drugs to prevent its interaction. Okay. Next question from isotonicity adjustment. Question from the problem, that is isotonicity adjustment. Find the amount of sodium chloride required to render 100 ml of 3% weight by volume solution of sulfacetamide isotonic with that of the blood. Okay, so here we have by freezing point depression method. Okay, the method or the data we have is the freezing point. So here we have to use the method of cryoscopic method or the freezing point depression method, whereas the freezing point of 1% weight by volume of sulfacetamide is minus 0.132. Freezing point of 1% sodium chloride is minus 0.58, whereas freezing point of blood is minus 0.52. Okay, so we will see. Yes. So what is the formula? Yeah. So what is the formula? The freezing point depression by 3% sulfacetamide. If it is usually sulfacetamide, it is given. It is no percentage is given. We have to generally go with the formula. Okay. So what is the formula? What is the formula? So the volume required, or the volume or the percentage required, volume percentage required, or the amount required is equal to 0.52 minus A by B. Okay, 0.52 minus A by B. Okay, so where A is the freezing point depression, where A is the freezing point value or freezing point depression value of the drug solution. Here it is sulfacetamide. Is that of the sulfacetamide. A is the freezing point or freezing point depression value of sulfacetamide. That is the drug. And B is the freezing point or freezing point depression of the adjusting substance with which we are adjusting. With what we are adjusting. That is that of the sodium chloride. Here the adjusting substance is nothing but sodium chloride. Okay. So it is 0.52 minus A by B upon B. Okay. So but here they have mentioned that it is 3% acetamide, sulfacetamide solution. So it will be 3 into A. Please remember, you have to multiply its concentration. We have to multiply its concentration. So here it is 0.396, 0.132. Actually, the freezing point depression as given is 0.132, but it is 3 into 0.132 minus 0.396, but it is needed is 0.52. It is needed is 0.52, that is 0.124. Okay, so the sodium chloride that is required, here is 0.124 upon 0.58. That 0.58 is the freezing point depression of sodium chloride. So here we have, here it is 0.124, 0.52 minus 3a. Minus 3a is 0.124 upon 0.58, that is 0.217 grams per 100 ml. Very probable questions. Okay, questions from pharmaceutical calculations. In the previous paper we have discussed question from alligation method. Okay, alcohol dilutions by alligation method. Alligation method, like that is the dilution alligation method, and questions from isotonicity adjustment, especially cryoscopic method. So there are different methods for isotonicity adjustment. Again, there are different methods for isotonicity adjustment. There may be different methods. Okay, that is the most widely used three methods are the cryoscopic method or freezing point depression method, and the second method will be the sodium chloride equivalent method, and last one is the molecular weight method. Okay, these three are there. These three methods are used for the adjustment, but you have to choose the method, and they have different formulae. We have to choose the method depending upon the data that is given. For example, in this case here, if they, instead of freezing point depression, if they have given the sodium chloride equivalent value of sulfacetamide or so and so, yes, yeah, White Vincent method also there. Yes, they are also there. White Vincent method and all those methods are also there. But these are most widely used ones. Widely used are these three methods. Okay, and mostly cryoscopic method. So depending upon the data, if they have provided the data about sodium chloride equivalent, then use the formula that is respective to sodium chloride equivalent. Okay, so choose based on the data that is given. Okay, next question. Question from the parameters Km and Vmax can be assessed from. Question from nonlinear kinetics impact. The question from nonlinear kinetics 29. Question number 29 from nonlinear kinetics. Km and Vmax, that is Michaelis-Menten kinetics. Km and Vmax assessment. The parameters Km and Vmax can be assessed from what? Plasma concentration time rate, clearance rate, distribution rate, and extraction rate. Okay, so this Km and Vmax, Michaelis-Menten constant and maximum velocity. Vmax is the maximum velocity. Km and Vmax, they can be obtained from the plasma concentration time rate. Okay, they can be obtained from the plasma concentration time rate. They are Michaelis-Menten parameters. They are meant from the Michaelis-Menten parameters, usually using the Lineweaver-Burke plots. Okay, using the Lineweaver-Burke plots mostly. Okay, and next also we have question from pharmacokinetics, that is absorption. Okay, determination of absorption rate or so under compartment modeling, Wagner-Nelson method involves. Okay, under compartment modeling, the Wagner-Nelson method, it is useful for what? It involves determination of what? Determination of Ka from percent ARA versus time curve. Ke from percent ARA versus time curve. Ka from percent ARA versus concentration, and D plasma half-life. Wagner-Nelson method, what it is used for? Yes, very good. It is used for the determination of absorption rate constant, that is Ka. Okay, now that is Ka, absorption rate constant. Wagner-Nelson method, it is widely used method in the determination of absorption rate constant. Absorption rate constant, again, it is determined by many methods. Like method of residuals. Like the method of residuals, Wagner-Nelson method, Lou-Riegelmann method. Okay, so there are many methods for the determination of absorption rate constant, and these are Prominent ones. These are more prominent. Mostly, method of residuals and Wagner-Nelson are more widely used. If there is a single point data, okay, especially this is also usually asked, if the data is limited, if there is single point data for the absorption rate curve, or there is a limited data, especially in case of limited data, Wagner-Nelson method is more applicable. Okay, if there is extensive data, method of residuals is more applicable. And if there is limited data with respect to this particular percentage ARA versus time curve, and we have to determine the absorption rate constant with a limited data, Wagner-Nelson method is, in one compartment model, Wagner-Nelson method is most suitable one. In case of limited data, please remember. Yes. Okay, and next question we have is neosomes. Neosomes are bilayered vesicles of non-ionic surfactants. The bilayered vesicles which are made up of non-ionic surfactants are known as neosomes. Yes, we also know this very well, which are made up of non-ionic surfactants, which are, if it is made up of phospholipids, it is liposomes. If the same bilayered vesicles, if they are made of phospholipids, it is liposomes. But the bilayered vesicles which are made up of non-ionic surfactants are neosomes. The name itself, non-ionic neosomes. Okay, and we have the biological half-life. The first order biological half-life is the formula, or the biological half-life is determined by the formula in first order reaction, 0.693 upon K. So in a first order reaction, the biological half-life is determined by the formula 0.693 upon K. Okay. So whenever IP refers, so I'm not giving the complete question here because we are running short of time, that's all. Okay. Whenever IP refers to as store in a cool place, whenever IP refers something to as store in a cool place, means what is the temperature indication? Yes, very important. The temperature indication according to IP for a cool place is 8 to 25 degrees centigrade. If it is cold, they are referring to as cold, it is less than 8 degrees centigrade. Less than 8 degrees centigrade is cold, whereas cool is 8 to 25 degrees centigrade, whereas 25 degrees centigrade is the normal room temperature. Store at room temperature means you have to store at this particular room temperature, that is 25 degrees, around 25 degrees centigrade. Okay. Yeah. And we have the half-lives of various reactions of zero order reaction and first order. Okay. Half-lives of zero order reaction, it is A by 2K. For zero order reaction, the half-life is A by 2K. First order, it is 0.693 upon K. It was a match the following question. Please go through the question paper. Once it is available in our mobile app. It is available in our mobile app actually. Okay. And second order reaction, it is 1 by AK. And the third order reaction, it is 1.5 by A square K. By A square K. Okay, this question, it is also available in our mobile app. You can go through once. Please go through the mobile app. It's free to download, and the test is free to attempt. Please try to attempt as many tests as possible. Okay, so this was from Pharmaceuticcs part. Okay, next I'm going with the Pharmacognosy questions. Questions from Pharmacognosy. Yes. Next we have, match list 1 with list 2. Questions from resins. Pharmacognosy part. Questions from resins. Okay. Match list 1 with list 2. That is list 1. Type of resins. The question is from the type of resins. Oleogum resin, oleoresin, gum resin, oleogum resin, and a balsam. Very important. Slightly confusing, but very important. Absolutely important question from resins from Pharmacognosy. Yes, and we have the examples of asafoetida, turpentine, myrrh, and benzoin. See, when the suggestion is also given, think carefully before you proceed. Okay, oleoresin, gum resin, oleogum resin, and balsam. Yes, and the right answer we have is oleoresin. Okay, oleoresin is turpentine. Okay, turpentine is oleoresin here, and gum resin is myrrh. Gum resin is myrrh. Asafoetidide is a oleogum resin. Example for standard example of oleogum resin, asafoetida. Okay, or hing. Yes, we use as we call commonly as hing, asafoetida, and balsam which is benzoin. Okay, balsam, the example is benzoin. Okay, so this was the right answer, option A. Sorry. Okay, just a moment. One moment. Yeah. Okay, so this was about resins. Answer from resins, very important. Please remember, you have to study all the classification of pharmacognosy, resins, alkaloids, volatile oils, glycosides, the classification and their like respective C glycosides, C glycosides, and different types of glycosides, D glycosides, and all these things. Alkaloids, okay, tropane alkaloids, like quinoline alkaloids, all these things. The classification and their examples and their biological sources family. At least to this point, you have to be perfect. At least to this point, you have to be perfect with all the types of things. Resins again, oleoresins, gum resins, and all these things. Tannins, hydrolyzable, non-hydrolyzable tannins. Okay. Yes. So yeah. So these are their respective sources and their applications. Applications first. Next, we will go with the next question. Yeah. So these are the differentiators. Actually, the balsams we can differentiate. Balsams, they always contain aromatic acids. Balsams, they contain benzoic and cinnamic acids. Okay, they always contain aromatic acids. And oleoresins, they contain liquid or semi-solid preparations. Oleoresins, liquids and semi-solids. Gum resins, they are gummy in nature. And oleogum resins, all the three components are present. Okay, they contain aromatic acids, they contain oils, and they contain gums. Oleogum resins. Okay. Yes, we'll move to the next question. Extraction methods. Okay, so process in extraction, the steps in extraction: defatting, enzyme inactivation, acid hydrolysis, and fractional extraction. Okay, we have all these things. And the purpose for which these particular steps are used: removal of a glycone, prevention of glycoside degradation, separation based on polarity, and removal of chlorophyll and lipids. Very important. Okay, the steps involved in these extraction methods. Okay, various steps involved in extraction and their respective purpose. And their respective purpose is important. Yes, defatting. Okay, so you just understand the procedure, even if you are not that clear. Just go with understanding of the options. So defatting. Usually, what happens? Defatting, removal of lipids. We have here removal of lipids. Defatting is the removal of chlorophyll and lipids. Okay, enzyme inactivation, which prevents the glycoside degradation. Enzyme inactivation. Then go for acid hydrolysis to remove the aglycone part, and the fractional extraction. Fractional extraction is which? Fractional extraction, separation by polarity, fraction. Okay, fractional is always, it is dependent on certain polarity or boiling point, anything. Fractional, the word fractional, it refers to any which is relative term. Okay, so separation by polarity. Okay, next question from Introduction to Pharmacognosy. We have in column 1, we have the scientist, and in second column their respective contributions. We have Galen, diasporites, Pedanius diasporites, and Seidler. Okay, and they have father of pharmacognosy, De Materia Medica, Galenical Pharmacy, and coined the term pharmacognosy. Yes, we have Galen. He's like Galenical Pharmacy. Okay, he is related to the Galenical Pharmacy. The Galenicals, we all know very well about Galenicals. We have so many types of Galenicals like Bhasma, Slehya, Asava, Arishta, all these things. There are several types of Galenicals. Okay, they are all together known. They are known as Galenicals, tinctures, extracts, all these things. And diasporites, who is the author of De Materia Medica. Okay, Pedanius diasporites, also father of pharmacognosy. Okay, he is known as the father of pharmacognosy. Same, diasporites and Pedanius diasporites, one and the same. Who is the author of the book De Materia Medica, first book it is from the Pharmacognosy. And Seidler, who is the person who coined the term Pharmacognosy. Yes. Next question from volatile oils, and choose the following statements regarding the volatile oils. Statement 1, they evaporate on exposure to air without leaving a permanent stain. Statement 2, they are soluble in fixed oils. Statement 3, they are generally optically active. And statement 4, they undergo rancidity on storage. Yes, volatile oils, what are the properties? Is 1, 2 and 3 only. 1, 2 and 3 only. They do not undergo rancidity on storage. Whereas fixed oils, they undergo rancidity on storage. Volatile oils, they do not undergo rancidity on the storage. It is one of the major differences between volatile and fixed oils. Okay. So these are the right options. Next. Yeah, this is the major difference between volatile and fixed oils. Just now I was talking. Okay, the fixed oils, they undergo rancidity on storage. Okay, and they have a permanent stain. They usually leave a stain. Whereas volatile oils, they don't usually leave a stain. Okay. Next. Yeah, wool on treatment with coaxium solution. Question from fibers. This is an absolutely important question. Wool on treatment with coaxium solution, it produces what? Black color, red color, blue color and green color. Wool, it is a type of fiber, natural fiber wool. Coaxium solution means, coaxium solution is cupra ammonium hydroxide, copper ammonium hydroxide, coaxium, copper ammonium hydroxide, coaxium. Okay, so it reacts with wool. Okay, when coaxium solution it reacts with wool, it produces a blue or violet color. Okay, it results in blue or violet color coaxium solution on reaction with wool. Okay, so I have a mnemonic here. Wool plus coaxium, it gives a wonderful blue. Okay, wool in reaction with coaxium, it gives a wonderful blue. Okay, it gives blue color. Very, 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 very important question from fibers. Okay. So usually what happens? This coaxium solution, it is naturally blue in color actually because it contains copper ammonium hydroxide. Okay. In reaction with wool, it produces blue or violet. In silk, also with silk, it gives a blue violet. With cotton, it gives deep blue. With synthetic fibers, it does not react, in fact. Okay. In case of synthetic fibers like nylon and all these things, they do not give any reaction with coaxium solution. No reaction. Okay. It does not react with the synthetic fibers. Very important. Coaxium solution. Okay. So question from tissue culture, plant tissue culture. Which of the following causes fruit ripening? Fruit ripening is caused by auxins, cytokinins, gibberellins and ethylene oxide. Ripening is caused by what? Yes, all of you. What happened? What happened to you all? Please answer. Yes, please answer. Yes, ethylene oxide. So you want some motivation, you want some push. Okay. Yes, ethylene oxide, very nice. Ethylene oxide. Okay, it causes fruit ripening. Okay. Causes fruit ripening. Ethylene oxide. Yes. Causes fruit ripening. Yeah. Next question. In Unani system of medicine, Mazoon refers to. Okay, questions from the systems of medicine. Systems of medicine, introduction to pharmacognosy. Systems of medicine. In Unani system of medicine, Mazoon refers to what? Mazoon refers to liquid preparation, semi-solid preparation, distilled product and powdered formulation. Similar to that of in Ayurveda, we have Bhasma, Lehya, Churna and all these things. In Unani also we have different terms. The terms are different. Okay. So Mazoon refers to what? Semi-solid electuary. Okay. Mazoon is something which is a semi-solid electuary. Okay. If it is a liquid, so in Unani dosage forms, just now we discussed in previous in our previous session about the Ayurvedic preparations. Bhasma, it is a powder. Churna, okay. Churna is something which is semi-solid. Lehya, semi-solid again. Okay. So Bhasma is calcination. Churna is a dry powder. Okay. All these things. Asava and Arishta, they are liquid preparations. We have discussed all these things. In the same way, in Unani preparations, we have liquid. Okay, liquid means sharbat. Liquid is sharbat. Ark. Okay, arak they call. Arak they call. Usually they call in arak they say. Arak means distilled water is arak. Sufaf means powder. Okay, sufaf is similar to churna. That is powder. Hab or kursi. Hab or kursi means pill. Kursi means pill. And mazoon is semi-solid. Lock means linctus. Lauk means linctus. And rogan. Okay, rogan is oil. Okay, we usually see these terms in advertisements most of the times. If you can go through the preparations, you can see in Unani preparations. Okay. Next we have question from marine pharmacognosy. Marine pharmacognosy: red algae, brown algae, crustacean shells, and sponges. And options here we have are agar, alginate, chitin, bioactive alkaloids. The marine sources and the respective product which is obtained. Yeah. Okay. And red algae. Red algae we have agar is obtained from red algae, that is gelidium. Okay. From the red algae, gelidium or gracilleria, we get agar. Okay, we get agar. From the brown algae, we get alginate, laminaria species. Okay, the laminaria species we get the brown algae, that is laminaria species we get alginates. Okay, and crustacean species we get chitin. Okay, C for chitin. Crustacean species we get the chitin, and the sponges. And from various bioactive sponges we get the various bioactive alkaloids. Okay, from Halichondria, Dysodermia, etc. we get eribulin. Like these are all bioactive compounds which are used in vitarabin. Okay, all these things we get from the sponges. Okay, marine sponges. These are usually bioactive agents mostly used in the chemotherapy. Bioactive agents mostly used in as antivirals and anti-cancer agents in chemotherapy. Okay. Yes, so these are the various sources: red algae, agar, brown algae, and all these things. Yes, just now we have gone through all these things, and we have the herbal drug technology question from herbal drug technology also prominent. Yeah. So the marker compounds, extractive values, HPTLC fingerprint, and stability testing, and the quality control parameters. Okay, what are the tests and their respective quality control parameters? Quality, consistency, solvent efficiency, identity confirmation, and shelf life. So what are they? We will go. Okay. So marker compounds. They refer to the quality consistency. Marker compounds are a reference of quality consistency. Extractive value. It is an indication for solvent efficiency. This is used to determine the solvent efficiency. HPTLC fingerprinting is for the confirmation of identity of that particular compound. Structural identity or the conformational identity of the compound. Okay, which type of a compound is it? And the stability testing is done to determine the shelf life. Of the respective product. Yes. So all these things we have a complete answer key again, and then next we have questions from pharmaceutical jurisprudence. At a quick review, pharmaceutical jurisprudence. Okay. Pharmaceutical legislation or pharmaceutical jurisprudence. I'll go at a quicker pace. Okay, next. Match list 1 with list 2. Poisons Act. Okay, question from Poisons Act. In fact, Section 3 of Poisons Act, Section 4 of Poisons Act, Section 5, and the rule making power according to Poisons Act. Very important sections of the Poisons Act and the categories of the drugs that are scheduled under Poisons Act. Okay, in Poisons Act, we usually have list A poisons, list B poisons, and the schedules of the poisons. Very, very, very important. And the sections of Poisons Act. Absolutely important. Most probable question in your final examination. Okay. So the Section 3 of Poisons Act, it deals with the powers of the state government. Section 3 of Poisons Act, it deals with the powers of state government. Section 4 deals with the licensing of sale. Section 5 with the penalty provisions, and section rule making with the import legislation and without of the import legislation. Okay. Next, the statement regarding punishments under NDPS Act. Again, highly important. Punishments under NDPS Act, absolutely important. Okay. Statement 1. The punishment depends on whether the quantity involved is small, commercial or intermediate. Statement 2. For commercial quantity, the minimum punishment is 10 years of rigorous imprisonment and fine of ₹1 lakh. Statement 3. For small quantity, imprisonment may extend up to 1 year. So, which of these statements are correct regarding the punishments with regard to the NDPS Act? With regard to the NDPS Act. Okay. Yes, all the statements are correct. All 1, 2, 3 are correct. Absolutely correct. Punishment depends on the quantity, whether it is involved at small, commercial scale or intermediate scale. It is true. And statement 2, for commercial quantity, is very true. The minimum punishment is 10 years and with a rigorous imprisonment of 1 lakh. Yes, all these are true. Okay. Because see, for a small quantity, usually for a small quantity, it is below specified threshold. It is up to 6 months to 1 year. 6 months to 1 year. If it is intermediate quantity, that is small to commercial. Between small and commercial, it is up to 10 years imprisonment with fine. Commercial, if it is commercial scale, it is not less than 10 years. It may extend to 20 years also. 10 to 20 years. Maximum time limit is 10 to 20 years and fine more than 1 lakh. Okay, so it will be up to 1 to 2 lakhs. Okay, so it is dependent on the quantity. Again, dependent on quantity and type. Very important. This is also very important. It is heroin, which is considered as small quantity, which is considered as commercial quantity. It depends again on the type of molecule, also type of drug. Okay, for heroin, it is 5 grams is small quantity, 250 grams is the commercial quantity in case of heroin. Okay, especially most of the times they ask about cocaine and cannabis. Small quantity and larger quantity. Most of the times the questions appear from cocaine and cannabis. Most widely repeated questions. Okay, for cocaine it is 2 grams is small quantity. In case of cocaine, 2 grams is small quantity and 100 grams is commercial quantity. Okay, in case of cannabis, that is ganja. Cannabis is nothing but ganja. That is 1 kg is small quantity. How 1 kg can be small quantity? But NDPS has designed like that. Okay, 1 kg can't be a small quantity, of course. Right. You people need to change the regulations. You have to get into regulations and change the regulations. Come on. Okay, cannabis 1 kg is small quantity and 20 kg is commercial quantity. Okay, this is better actually. Opium, 25 grams of opium is small, whereas 2.5 kg is commercial quantity. Very important. This complete slide is absolutely important. You will get one question from this slide. Definitely, compulsory one question from this slide. Okay. So next we have the authorities and their functions with respect to NDPS, Narcotic Control Bureau, Central Government, State Government and International Narcotic Control Board and their respective functions. In the respective functions we will see Narcotic Control Bureau. It is a nodal law enforcement agency. It deals with the enforcement. National, yes, deals with the enforcement, and central government deals with the policy. Central government is about the policy. State government is about the implementation. State government deals with the implementation of the act. Okay, state government has nothing to do with the NDPS Act. It only deals with the implementation. No rule making, no enforcement, no policy making. Okay, policy making is completely taken care by the central government only. State government does not have any take. It only has to follow, implement. That's all. Okay, because this is completely under the control of central government. And international, INCB, International Control Board. It is international imports and exports and all these things of narcotic drugs. Next question we have match the drug schedules with their provisions. Drug schedules with their provisions. We have Schedule H, X, M and Y. Schedule H, Schedule X, Schedule M and Y. We have and their respective provisions, GMP requirements, prescription drugs, warning labels, narcotic and psychotropic substances, control and clinical trials and new drug requirements. Yes, we have the Schedule H is for prescription drugs. Yes, we all know it very well. Schedule H for the prescription drugs. Schedule X for narcotic and psychotropic substances. Control, yes, controlled substances. R for controlled substances under Schedule X, Schedule M for GMP requirements, and Schedule Y for the clinical trial and drug requirements. Okay, we all know this very well. Very important. Don't always expect that someone will ask you what is Schedule H, what is Schedule X. Most of the times, this match the following types of questions are very, very probable in case of this jurisprudence. Very probable. Okay. Next we have this medical termination of pregnancy. Okay. Question from below that calendar. Beneath this calendar. Okay. Next we have the Medical Termination of Pregnancy Act, which was amended. So see this question, please read the question completely. This question was from the amendments of Medical Termination of Pregnancy. It is actually the Medical Termination of Pregnancy Act. It was introduced in 1971 and it was amended in 2021. The amendments were made in 2021. Okay. So the question is about the amendments in 2021, related to the amendment in 2021. What are the features? Okay, termination up to 20 weeks, termination from 20 to 24 weeks is beyond 24 weeks, and termination of minor pregnancy. So we have yes, very, very good. Whoever have answered A, absolutely good. See, please remember. See the question completely. It is according to the amendments of 2021. Very important. The amendments of Medical Termination of Pregnancy Act 2021 are very important. Okay. So up to 20 weeks. So before 2021, you see, before 2021, if it is 12-week pregnancy, it is limited to one doctor. But after 2021, if it is 20-week pregnancy, it is limited to one doctor. The lower limit. Okay, and the upper limit. It is 20 weeks, 2 doctors are required according to 2021. Before 2021, now it is 24 weeks for special categories. It is 24 weeks, not 20 weeks. It is increased slightly due to changed circumstances and all. 24 weeks. Okay, beyond the 24 weeks, before 2021, this termination of pregnancy was not allowed. If it is beyond 24 weeks, now it is allowed. After 2021, termination of pregnancy even after 24 weeks is allowed with a proper medical reason, if it is from the proper permission from the medical board. Okay, so for unmarried women, it is not explicitly included. The termination of pregnancy for unmarried women, it was not included in 2020 in 1971. But after 2021, yes, the provisions required to the medical termination of pregnancy for unmarried women were also included. Okay, these are the major differences between 1971 Act and 2021 Medical Termination of Pregnancy Act. Very important. Okay, so whatever are given here, you just go through. Okay, just go through. Next, misbranded, adulterated, spurious. Again important. Again very important. So this is a very high quality question paper actually that we have given today. If you go through the question paper, you will understand it. It is a very real time level and it is a high quality question paper, high yield, high quality question paper. A drug is considered misbranded if it is not labeled in the prescribed manner. A drug is considered adulterated if it contains filthy, putrid or decomposed substances. And a drug is considered spurious if it is manufactured without a valid license. Okay, so statement 1, 2 are correct. 1, 2 are correct, but statement 3 is wrong. Okay, statement 3 is wrong. It is not about valid license. Okay, it is considered spurious if it is a fake drug. If it is a fake drug or counterfeited drug, that means one drug is manufactured in name of another drug. Counterfeited drug, not related to license. It is if it is some other drug. Okay, some other drug is manufactured under some other name, counterfeited drug. Okay. So this is about misbranded, adulterated and spurious drugs. The Medicinal and Toilet Preparations Act applies to preparations containing alcohol, opium, Indian hemp, other narcotic drugs. Okay, dear. Yes, statement 1 and 3 are correct. 2 is wrong. The Act provides for levy and collection of sales tax on medicinal preparations. No, it provides for excise duty. It provides for excise duty actually. Sales tax or GST, it is under different law. Okay, it provides only, it acts only for the excise duty. It is not for sales tax or GST. GST is under some other act again, some other trading act. Okay, under that act of trade, not under medicinal and toilet preparations. Okay, drug pricing and wholesale price index. Question from annual price revision mechanism. So what it is? Wholesale price index. Okay, what is wholesale price index? It is, yeah, the formula is new ceiling price equals to old ceiling price into 1 plus the change in the wholesale price index. Okay, next, the loan license. Under Drugs and Cosmetics Act comes, which is under the Drugs and Cosmetics Act, manufacture of certain drugs requires a loan license. Yeah, loan license issued to an applicant who does not have his own manufacturing facilities, uses the facilities of another manufacturer. Yes, both A and R are true. Both A and R are true, and R is the correct explanation of A. Yes, that is the same statement for loan license. Next, we have questions from biochemistry. Questions from biochemistry. Aldopentose can be converted to aldohexose by yes, by Killeney-Fisher synthesis. By Killeney-Fisher synthesis, we have, yes, it is for chain elongation. Okay, this is for chain elongation. Aldopentose can be converted to aldohexose. That is chain elongation reaction can be ascertained by Killeney-Fisher synthesis. Next, we have essential and non-essential amino acids: lysine, threonine, serine, and histidine. Which one is a non-essential amino acid? Very, very important. We may get probable questions from essential and non-essential amino acids. Yes, serine. Serine is the right answer. Serine is a non-essential amino acids. Yeah, we have PVT Timhol. Yeah, PVT Timhol. This is a mnemonic for essential amino acids. Phenylalanine, valine, threonine. Yes, valine, threonine, isoleucine, methionine, histidine, leucine. These are essential amino acids, whereas serine is a non-essential amino acid again. Yeah, loosening of teeth, gingivitis, and hemorrhage are caused due to the deficiency of which vitamin? Vitamin C. Vitamin C, ascorbic acid deficiency, scurvy. Okay, these are all the symptoms of scurvy. Loosening of teeth, gingivitis, and hemorrhage are the symptoms of scurvy. Okay, next we have questions from microbiology. Okay, anti-enzyme is a monooxidase. Anti-enzyme, which is a monooxidase inhibitor here. Yes, salicylene. Yeah, right answer is salicylene. It is a monoamine oxidase inhibitor. It is an anti-enzyme, in fact. It's an anti-enzyme. Yeah, which test detects albumin in urine? Very important question from biochemistry, which is related to everything. Clinical pharmacology kind of test detects albumin in urine. Yes, it is dipstick test. Is the dipstick test, which detects albumin in urine. Yeah, we have questions from microbiology. Which of the following is an example of killed viral vaccine? Killed viral vaccine among the following: rotavirus, hepatitis B, A, yellow fever, and tetanus toxoid. Killed viral vaccine among the following is hepatitis vaccine. Is a killed vaccine. Okay, it is a killed vaccine. Next, declining growth rate occurs during which phase of bacterial cell growth? Cell from bacterial growth rate curve. Question from, declining growth rate occurs during which phase of the bacterial cell growth? That is during the death phase. Okay, declining growth rate occurs in the death rate curve. In the final stage, that is the decline. See, decline phase, we have a declining growth rate. Okay, in the lag phase, there is no change. Log phase, there is an exponential growth. In the log phase, there is an exponential growth in the exponential phase. Log phase is also known as the exponential phase, in fact. Okay, high increase, logarithmic increase in the growth rate of the bacterium. Okay, next, what is the optimum temperature range for bacterial growth of mesophiles? For mesophiles, yes, mesophiles, it is 37 degrees, approximately 20 to 45 degrees, approximately 37 degrees centigrade. And psychrophiles less than 15 degrees centigrade, cold loving microorganisms, cold loving organisms, psychrophiles. And thermophiles, which heat loving organisms greater than 45 degrees, greater than 45 degrees. Which of the following is a facultative anaerobe? Facultative anaerobic microorganism Clostridium botulinum, Neisseria gonorrhoeae, Escherichia coli, and Helicobacteria pylori. Helicobacteria pylori. The right answer is Escherichia coli. Escherichia coli is a facultative anaerobe. Okay. So facultative anaerobe is it can grow with or without oxygen. This is facultative anaerobes. Okay. So obligate anaerobes we have which cannot survive in the absence of which cannot survive with oxygen, in the presence of oxygen. In the presence of oxygen, Clostridium botulinum, obligate aerobes and microaerophiles we have. Okay, next. The key step that differentiates gram positive and gram negative bacterium in gram staining. Very important question. The key step that differentiates gram positive and gram negative bacteria in staining. Application of crystal violet, application of iodine alcohol decolorization, and use of saffron. Right answer is right. No. Application of alcohol decolorization. First, while applying, everything is good. In during application, everything is good. It is alcohol decolorization. In decolorization, what happens? Gram positive bacteria, it stays purple. It retains its violet color, whereas gram negative bacteria, it turns to another color. Okay, it is alcohol decolorization. Very important question. A very important question. Okay, that's what we go in the application of, because soon as we see this crystal violet, we think that yes, it is. So gram positive is in violet color because it is not denatured. It is not denatured and it stays purple or violet. Okay. Yeah. Yes, so these were the questions from. Okay. No worries. Just focus, just concentrate. Immediately, yes, seeing this question, everyone will go with the option A, crystal violet, because crystal violet it stains the gram negative bacteria as violet, okay, as blue. We are very used to it. Okay, it is about its color removal, not about its stain removal. Okay. So this was about questions from pharmacology, pharmaceutical jurisprudence, pharmacognosy, biochemistry, and microbiology. So please stay tuned. We are going to discuss some questions from pharmaceutical chemistry. Okay. Please stay tuned as one of our team members. Okay. The other team member is going to discuss questions from pharmaceutical chemistry and analysis at this moment. Okay, we will have a quick discussion again. Okay, please stay tuned as we will be away for one moment. Okay, please do not go away. Thank you very much for your patient listening, and please do post your questions and reviews in the chat box. Okay, thank you all very much. We will stay connected. We'll get to you soon.
So hello everyone, good evening. Actually, I get 2 minutes of time for you to take some rest. Okay, like break. From last 3 hours, you people are studying continuously. That's why I gave 2 minutes of break. Let's start pharmaceutical chemistry. Am I audible or not? Let me know. Am I audible? Am I audible or not? Please. Am I audible or not? So we are going to start pharmaceutical chemistry, and within half an hour, 40 minutes, we will complete that. Okay, let's start. So what is the last question? Compound X changes the color of warm acidified sodium dichromate from orange to green. 1 mole of X react with 2 mole of HCl, that is cyanide, in the presence of potassium cyanide. Okay, what could be X? Now the most important point is that the color here. Okay, first of all you have to understand that color orange changes from orange to green, right? So in that, see, 1 mole of X is reacting with 2 mole of HCl. Okay, now. So that means in that HCl is the main reagent here. That 2 mole of HCl is reacting with 1 mole of X. So in that means this HCl will react with alcohol or it will react with OH. Okay, now. So it will form alcohol OH, but it will react with carboxyl group, that is double bond O. So two double bond O should be there in the compound. So see the compound, that is only one CHO. In that compound, one C double bond O along with that one CHO, but it is not aldehyde. Here, if I say that is formed with OH, OH means that OH should be reduced from, and it is reduced from of alcohol. When alcohol, it is reduced from aldehyde. When aldehyde is reduced, it directly forms alcohol, right? So that means here this potassium cyanide, in the presence of potassium cyanide, HCl will react with N aldehyde and it will form alcohol by reducing it. So in the question, see, one aldehyde, there is no aldehyde, one aldehyde, and here one aldehyde, and there is another aldehyde, two aldehyde. So in the compound D, you will see two aldehyde are there. So compound D will be the correct answer. Why? Because two molecule of HCl is reacting with 1 mole of X. So this compound is completely an X. This compound is completely an X. But in that compound, the 2 mole should be react. That means the HCl is reacting with the functional group. It should be present 2 times, right? So that is 1 and 2. Okay. So what is the answer? The answer is D. Next, the reaction between an aldehyde and HCl catalyzed by NaCl. Which statement about the reaction mechanism are correct? A new carbon-carbon bond is formed. In the intermediate, the oxygen carries a negative charge. The last stage involves the formation of hydrogen and oxygen bond. So what is the correct answer? समझ नहीं आया. Okay, which one? First one. Okay, let's repeat that one again. See, there is a compound X. These all are denoted as compound X. In that compound X, there are two active sites on which HCl is reacting. That's why 1 mole of X is reacting with 2 mole of HCl. So 1 mole, another mole. Now is it okay? Now you understood? In the compound X, two active sites are there where the HCl will react. So HCl will generally react with the aldehyde. Aldehyde means what happened? Why it is not reacting? One second, please. So in 1 mole of X, 2 mole of active site will be present. Sorry, 2 active site will be present in which 2 mole of HCl will be reacting. So 1 mole of HCl will react with one active site, for example A, and another 1 mole of HCl will react with another active site, that is for example B. Now let's see the compound CH3, CH2, CH2, CHO. In that only one CHO is present, aldehyde, right? In that there is no aldehyde. In that one aldehyde is present, but in that compound two aldehydes are present. So one aldehyde CHO is active site 1, another aldehyde CHO is active site 2. That is active site A and active site B. Now you understood or not? In option 2, active site is there. Understood. In option 2, CH3CO, that is carbonyl compound, but this is a ketone group. And here you see COCH3, again it is also a ketone group. The structure, okay, I will draw the structure. First one, for example, B. So B structure will be like this: CH3C, double bond O, single bond CH2, single bond C, double bond O, single bond CH3. What is that? 1, 2, 3, 4, 5. Pent 2,4-dione, that is pentone, that is ketone. But in the case of D, you will see two active sites are there: one C, double bond O, single bond H, connected with CH2, that is connected with CH2, and that is connected with C, double bond O, single bond H. Now in that C, two aldehyde are present. Yes or no? Now when HCN will come, I'll tell you properly now. Complete mechanism. 1 second. See, in that compound, C double bond O, single bond H, CH2, CH2, C double bond O, single bond H. See, this oxygen is highly electronegative, right? When it is highly electronegative, it will be partially negatively charged. That means electron density will be more in that, right? When HCN will come, then in HCN, Cn is negatively charged and H is positively charged. This negatively charged cyanide will come and it will bind to the positively charged. So when this oxygen is partially negatively charged, this carbon will be partially positive charged. Electron density will be less in carbonyl carbon. In that case, what will happen? That Cn will come and it will bind to the carbonyl compound. Correct? Thanks for the question. Okay. So when it will come and bind to the carbonyl compound, actually I am not going so deep. Why? Because time is very less. You people are already studying from last 3 hours continuously. Okay, that's why I was going a little bit fast. So let's go a little bit fast, or let's go in depth. Tell me first. Tell me please fast. Okay. Yes, you said phenophrenical. Yes, you are correct. So in that, this cyanide will come and bind here. Then what will happen? Then repulsion. When that cyanide will come and bind here, in this carbon, Cn will come and it will bind. After that, what will happen? That hydrogen will go and it will move there. Okay. This hydrogen is already positively charged, right? This positively charged hydrogen will go and it will bind with the negatively charged oxygen. When it will bind with the negatively charged oxygen, what will happen? The alcohol will form, OH will form. Correct? This is the actual mechanism of reaction of X with HCl. You understood that? Let's go forward. Okay. So, two alcohol will form in there. That's why the correct answer is D. I hope you people are clear with that. If you have any doubt, you ask me. Let's see the next question. In the reaction between an aldehyde and HCl catalyzed by NaCl, which statement about the reaction mechanism are correct? Just now I have shown you one thing, and that is in that also HCl was reacting, right? When HCl was reacting, what will happen? That double bond O is having negatively charged and carbon is having positively charged, right? So in that, a new carbon-carbon bond will form. Yes. So what was happening when Cn was connecting, and it will see like this. When Cn is coming and binding with the carbon, positively charged carbon, that's Cn negative. This carbon-carbon bond is forming or not. After that, what will happen? Then nitrogen will go away. It will eliminate. When it will eliminate, ultimately what will happen? A carbon-carbon bond will form. That means first option is correct. Next, in the intermediate, the oxygen carries a negative charge. This is also correct. In the last stage, involves the formation of hydrogen oxygen bond. Okay, so in the last stage involves the formation of hydrogen oxygen bond, but that is not actually in that case. In that case, when NaCN is reacting, in that case it will not correct. In that case, that sodium will come and sodium will bind with the oxygen. Okay, na? ONA will form. So this is the wrong answer. So A and B are correct. So both A and B are correct. Okay, you understood or not? Yes, nucleophilic correct. You are 100% right. So answer is here. No, it is wrong. Answer is not A. The answer is not A. The answer is D again. D means both A and B are correct. Okay. Next, what is the next question? Should we go a little bit fast or slow? D is correct. Yes. Next, CH3 C triple bond C. 40% H2SO4 and 1% HgSO4. That is reducing reagent. You have to remember that is reducing reagent. Okay. So when it will react, A will form, and again in the A, isomerization will take place and ketone will form. So what will happen? Structure A and type of isomerization in the above reaction are respectively. Prop 1 into yes. When H2SO4 will come, SO4, SO3 and OH will be there. Okay. So this OH will go and it will bind to the middle one. See, CH3 bond C triple bond CH. Now what will happen? This is highly electronegative. This is highly electronegative. Positive charge will come and bind there. But that is electrophile will come and bind there. But when nucleophile will come, for example, there in the case of H2SO4, that SO3 and OH, this OH is the nucleophile, and when this OH nucleophile will come and it will bind to that middle one, you know what is Markovnikov rule? What is Markovnikov rule? Can anyone please tell me? Markovnikov and anti-Markovnikov. In the case of Markovnikov rule, the nucleophile will come and bind to the carbon which is having less alpha hydrogen, or simply in जो अंदर वाला कार्बन होता है, inside carbon, in that will bind simply. By this way you can remember also. And according to rule, you can't change the rule. So according to rule, the nucleophile will come and bind to the carbon which is having less alpha hydrogen. Okay. So let's see. This is the correct answer. So in that OH will come and OH will bind. So what will form? CH3, COH and CH3. Now double bond will remove, right? Triple bond will remove and it will form double bond, and here CH2 will form. Now we will see in the structure A, what is the option? Prop 1 into all. Prop 1 into all. Wrong. It is not 1 into all. It is COH. Next question. Prop 1. Yeah, okay. Prop 1 into all is correct. Prop 1 in 1, 2, 3. Prop 1 in 2 all. Correct. Next question. Metamerism. No. When it will form into this one, that is called ketoenol tautomerism. What is ketoenol tautomerism? I will explain you now. Yes, sir. Hydrogen bind to carbon, which is yes. More, not more hydrogen, less hydrogen. Next, prop 1 in 1 all. This is totally wrong. Prop 2 in 2 all. This is also wrong. See, 1, 2, 3. Prop. This is not double bond. This is single bond. First one. And second one is double bond. Prop 1 in 2 all. Prop 1 in 2 all. This is correct. Now here metamerism. No. Here tautomerism. Yes, this is correct. Which type of tautomerism? Ketoenol tautomerism. Ketoenol tautomerism. Now I will tell you what is ketoenol tautomerism. In some cases, alcohol is stable, and in some cases, carbonyl group is stable. Okay. If you struggle in such type of question, you should have basic concept. Okay, clear basic concept. And for clear basic concept, you have to understand organic chemistry very well. Right? Now I will show you what is ketoenol tautomerism. See, for example, in that case, CH3, COH, double bond CH2. In that, this OH is having electron. Oh, that oxygen is having lone pair, and this lone pair is again oxygen is having lone pair with this one. But in that case, these alpha hydrogen are less. You know what is the how the stability of alkene, or how the stability of ethene, not ethene, any type of alkene, stability of alkene is determined by numbering of alpha hydrogen. If the number of alpha hydrogen is more, the alkene will be more stable. If the number of alpha hydrogen is less, the alkene will be less stable. In that case, for example, take this one as the central atom, this carbon. Inside, in this side, how many alpha hydrogen are there? 2. In that side, how many alpha hydrogen? 3. 3 plus 2, how many alpha hydrogen? 5 alpha hydrogen. But when you will change it into keto form, this is enol form. Enol, all means alcohol. From alcohol, enol came. See, in that case, enol means, see, this one is alkane or alkene? Alkane or alkene? This one is alkene, right? And when this alkene along with alcohol is present, so in all, that is called enol. Carbon, carbon, double bond, carbon, OH. In all. That's why it is called enol form. This enol form can convert into keto form. In that keto form, what will happen? In that keto form, one carbon will be there, another carbon will be there, another carbon will be there. Like this, it was earlier it was like this, right? No, it was like this. Now in that case, what will happen? This hydrogen will be shifted to this carbon, and this double bond will be shifted to this oxygen. So the final product will form like this: CH3, single bond C, double bond O, and single bond CH3. Now see, if this is a central atom, that central atom has how many alpha hydrogen? Alpha means near to that carbon. How many alpha hydrogen? 3 plus 3. How many? 6. Yes or no? Along with that, if you see, this oxygen is highly electronegative. Now it has already double bond. Its octet is also complete. It will be stable. Yes or no? I am going a little bit fast. Do it fast. Oh, okay. Already I am doing fast. So in that case, it is called keto form. Keto means already one R, another R, in between two are carbonyl group. So what is aldehyde and what is ketone? In the case of aldehyde, you will see RCH, and in the ketone, you will see RC double bond or single bond R, right? So here one R is this one, another R is this one. Both are alkyl group, right? So they both of them are alkyl group, and in between alkyl group, if carbonyl group is present, that is called ketone. Yes or no? That's why it is called keto form, and that is called enol form. Enol form, and that process is called tautomerism. That is called ketoenol tautomerism. Okay. So ketoenol tautomerism will be there. So what is the correct answer? The correct answer is, what is the correct answer? The correct answer is D. Yes. The correct answer is D. Next question. Compound A and C in the following reaction are. Okay. So let's see the compounds. In the question CH3CHO, that is aldehyde or ketone? Can you please tell me? One second. Let me fix the camera. Okay. So in that, is it visible or not? I hope it is visible, and I am audible also, right? Am I audible or not? Please respond fast. Fast, time is very less. So in that CH3CHO is an aldehyde. So CH3 C double bond O single bond H. This is aldehyde. When this aldehyde will react with CH3 MgBr, what is that CH3 MgBr? You know what is that? RMgX, right? CH3 is alkyl group, Mg is magnesium, and Br is X. So RMgX is, what is that RMgX? RMgX is called Grignard reagent, and the reaction which takes place in the presence of Grignard reagent are called Grignard reaction, right? So in that case, that CH3MgBr will come and it will bind with this compound, that is aldehyde. So how it will bind, I will tell you in very fast. Already I have told earlier slide that this oxygen is highly electronegative. So what will happen? This oxygen will be having negative charge, partial negative charge. And when this oxygen is having partial negative charge, this carbon will be having partial positive charge. Why? Because most of the electron density are near to oxygen. The electron present in the bond are attracted by the oxygen because it has maximum tendency to attract the electron. When it has maximum tendency to attract the electron, what will happen? It will try to attract the electron from the bond. And when it will try to attract the electron from the bond, this oxygen will be having high electron density. When the oxygen is having high electron density, this carbon will be having low electron density. That is called del positive. Now you see in that CH3MgBr, what will happen? This CH3MgR negate this CH3MgR. No, in the MgBr, that MgBr is negatively charged and CH3 is positively charged. Once again, let me draw the structure. CH3MgBr. Magnesium is having two bonds. In that one is CH3, another is Br. Okay, this Br is having negative charge, and MgBr together are positively charged, bro. Why? Because this magnesium is having +2 charge. One +2 is filled by this bromine, and the remaining +2 is filled by this methyl group CH3. Okay, so in that case, what will happen? That CH3 is CH3 is negatively charged and MgBr are positively charged. This is ionic bond. This one is covalent bond, but this one is ionic bond. So this will come. This CH3 will come and it will bind here. When it will bind here, what will form? CH3 carbon double bond O, and this will come and it will bind here, right? So what will happen? CH3. Along with that, hydrogen is there. Correct? Now, when the step 2 is hydrolysis. Hydrolysis means, yes, Mg plus positively charged. Correct. So when after second, in the second step, after first step, in the second step, hydrolysis will take place. When hydrolysis will take place, simply what will happen? What will happen? Hydrogen will come and oxygen will come. OH will come, and OH will bind with one and hydrogen will. So see there. Along with that, MgBr is there now. So MgBr is there. Now when we will put H2O, in the case of H2O, one H will come here and OH is there. So this is OH. OH will bind with this one and it will form MgOH-Br. I hope you got this reaction, Grignard reaction in NEET preparation in the intermediate. And this hydrogen will come and it will bind with the oxygen. So what it will form? Alcohol. Which type of alcohol? Secondary alcohol. So CH3COH CH3. This is the secondary alcohol, correct? This is the product. This is product A or C. This is 5 bond. Why 5 bond? In that case, what will happen? One bond will break. Definitely one bond will break and oxygen will be having electrons. So oxygen is having electron, that means oxygen is negatively charged. In that case, this carbon will be positively charged. Thus CH3 is going and binding with the carbon. So this will have negative charge, and that H plus from water will come and it will bind with the oxygen. 5 bond. Carbon is having 5 bond. You are right. So in that case, this intermediate, it will break one bond from the double bond O, and that oxygen will be having now negative charge. Again, when we will do the hydrolysis, that hydrogen H plus from water will come and it will bind with the oxygen, and OH minus will go and it will bind with the Mg magnesium bromide. Already someone told in the earlier in comment that Mg plus. So Mg is positively charged. In that OH will go. OH is negatively charged. It will go and it will bind with the magnesium. Correct? Now you understand? Yes. So this is the product A, right? So product A is alcohol. Which type of alcohol? Secondary alcohol. So product A is alcohol. Now we will see the compound A and C in the following reaction are. Okay. Now again, when it will undergo H2SO4 reaction with H2SO4, what will happen? That OH will eliminate in the form of water, H2O, and what it will form? CH3, CH2, CH3. So that is alkane. This is alkane. Now this alkane again undergo hydroboration oxidation. In hydroboration oxidation, what will happen? BH3THF. You know BH3THF. That is called hydroboration oxidation. In that, the reagent is used is BH3THF. That is trihydrobromide. Am I audible or not? So trihydrobromide is used in the hydroboration oxidation. Now again, what will from BH3THF, along with the oxidation, oxygen will come and it will bind with the CH2 again. Why CH2? CH3, CH, CH3, and one OH will be there. Now in the hydroboration oxidation, anti-Markovnikov rule will be there. Anti-Markovnikov rule means, in Markovnikov rule, nucleophile will come and bind with the carbon having less alpha hydrogen, carbon having less hydrogen. That is Markovnikov rule. And when BH3THF is used, that is trihydrobromide. That is called hydroboration oxidation. In the case of hydroboration oxidation, anti-Markovnikov rule will be taking place. So according to anti-Markovnikov rule, nucleophile will come and bind with the carbon having more hydrogen. So either that OH will come and it will bind with the this CH3, or it will bind with the this CH3. So in that case, now it will not be CH3, it will be CH2, along with that OH will be there. So that is the compound C. So what is compound A and C? Compound A is CH3, COH, CH3. And what is compound C? C is CH3, CH2, CH2, OH. Correct? Yes or no? These two are the compound. Free radical, reaction, yes. Okay. You are good in organic chemistry. You should have very good basics in organic chemistry to understand the medicinal chemistry and pharmaceutical chemistry. So, see, in that case, both are identical. No. If Markovnikov rule would have taken place, in that case, both would have been identical, because both will be having oxygen hydroxide in the carbon which is present in the middle, right? But one is Markovnikov, another one is anti-Markovnikov. That's why no identical. One OH in the middle, another OH in the side. So positional isomerism, yes, this is correct. Functional isomerism, no, because both are alcohol. Optical isomerism, no, because both are having different positions. So what is the correct answer? And no one is having any kind of chiral center. So for to be optical isomer, it should have chiral center. Chiral center means a carbon should have 4 different functional group or 4 different substituent with the 4 different bond. Is it some English batch or course? हिंदी में समझा दोगे तो मजा आ जाएगा. So many students are studying from all over India. In that, some students are from Telangana, some students are present from Tamil Nadu also, some students are from North also. So it is better to explain in English. If you want Hindi, no problem. I'll explain in Hindi also. I'll add Hindi with that. Okay ना? So इसमें क्या है? OH center में है, इसमें OH side में है. So when OH are in different, that is called positional isomer. So what is the correct answer? The correct answer is positional isomer. Yes. So let's see the option. Yes, answer B. Positional isomer. Correct. Next, when acetaldehyde reacts with sodium hydroxide, it forms a beta hydroxyaldehyde. Oh my God, very important. Aldol condensation reaction. It is a name reaction. Very important. Do it in English. Okay. Thank you. So you know in the aldol condensation, you know one thing. In GPAT, cent per cent one name reaction will come. Last year also one reaction came in GPAT 2025. And in NIPAR, you will get so many questions from organic chemistry. That's why understanding pharmaceutical organic chemistry is very important. Okay, na? And actually, I also have a what it is called YouTube account channel, that is Medicinal Insights. In that, I used to explain organic chemistry, pharmaceutical organic chemistry, and medicinal chemistry, basic organic chemistry. So when acetaldehyde reacts with sodium hydroxide, it forms a beta hydroxyaldehyde. Whenever you will see beta hydroxyaldehyde, whenever you why the board is not working properly. Whenever you will see a beta hydroxyaldehyde, that beta hydroxyaldehyde is final product and the reagent is sodium hydroxide and the reactant is aldehyde. You have to remember that is aldol condensation. Okay, if you want to clear your basic organic chemistry, yes, you can see this one. Medicinal Insights. In that, I used to explain all the organic and medicinal chemistry. YouTube account. So let's continue. In the aldol condensation, you will see acetaldehyde. This is acetaldehyde, right? In acetaldehyde, you will see two acid. Acid means two carbon, and two carbon having aldehyde. This is product 1. Again, you will see another product, that is product B. Both will be reacting in the presence of sodium hydroxide, right? Both will be reacting in the presence of sodium hydroxide. Now, the most important thing is that when they will react, what will happen? Same thing. In the carbonyl chemistry is so easy, you know, because once you will understand the basic, you can automatically do all the reactions by yourself only. See, again, same thing. Oxygen is highly electronegative, partially negatively charged, so del negative, and that carbon is partially positively charged, so del positive. Del positive, del positive, del positive, del negative, del negative, del negative, like this. Same thing. Now, in the NaOH, this Na is positively charged, OH is negatively charged. Correct? Is it clear or not? Now what will happen? This OH will come and it will bind with the carbon. So when this OH will come and it will bind with the carbon, what will happen? CH3, C, double bond O, single bond H, one OH. Again, someone asked about five bond. See, five bond. So what will happen? This bond will go there, and that oxygen will be negatively charged. When this oxygen will be negatively charged, what will happen? Na plus will come and Na plus will bind with this one. So ONA will form, and this OH is there, right? Yes or no? Yes. Now you see, this is an alcohol, and this one will automatically break and ONA will go. So this is an alcohol. Now this alcohol and this and here H will come and H will bind with this one. How it will come and bind with this one? Now I will tell. See, first one is acetaldehyde, and when acetaldehyde will come and bind with the alcohol, what will happen? It will form the compound like this: CH3, C double bond O, single bond hydrogen, acetaldehyde, and this one will come and it will bind with this one. So CH3, C double bond O was there. Now it will be single bond O. Along with that, H will come and H will bind with this one, and there another OH is there, and another hydrogen is there. So now what will happen? Another hydrogen will come after hydroboration. Sorry, after hydrolysis, and this water will go away. Now another CH3 is there, right? So in that one hydrogen will come and it will take that place. So the compound will be like this: CH3, C double bond O, CH2. Now CH2 here, and this carbon having one hydrogen here and one hydroxide here, and along with another hydrogen is there also in that side. Here another hydrogen like this. Okay now. So can you please tell me what will happen to the center carbon? This one, ये बीच में जो है, ये बीच वाला क्या होगा? It will bind with this carbon and it will make bond with this one. So the compound, final compound will be like this: CH3, C double bond O, single bond CH2, and it is forming bond with the that carbon. You understood or not? That carbon, and there hydrogen will be as it is. Hydroxide is there, hydrogen is there. Now, can you please tell me what is alpha carbon and what is beta carbon? Anyone? Please tell me what is alpha carbon and what is beta carbon. What is alpha carbon? Fast, response fast. We have to complete that pretty fast. Alpha carbon means the carbon which is present just beside the carbonyl carbon. So this is the carbonyl carbon, C double bond O. So along with the carbonyl carbon, this carbon is called alpha carbon, and next carbon is called beta carbon. So this is beta carbon, right? This is beta carbon. Now see in the question what they are telling. Then when acetaldehyde reacts with sodium hydroxide, it forms a beta hydroxyaldehyde. Can you please tell me this is beta hydroxyaldehyde or not? This is beta hydroxyaldehyde or not? See, 1, 2, 3, 4. In that one double bond O is there. Double bond O is there. Along with that, at beta position, one OH is there. So alpha, beta position, beta hydroxy, and this is aldehyde. So what I have mentioned earlier in that, this is actually I added both the compound in opposite direction. You can add this one from this side. When you will add from this side, it will form this compound. Let me draw the complete structure again. See, CH3, C double bond O, single bond, hydrogen. Okay, plus CH3, C double bond O, single bond, hydrogen. And I have shown there that by reacting, what will happen? CH3 will be there, OH will be there, along with that hydrogen will be there, right? Yes or no? So now this one will come. For example, this one will change into this form by reacting with NaOH. Yes or no? Alpha, beta, unsaturated aldehyde. Yes, aldol, alpha, beta. That is different. In that case, alpha, beta both will be having different forms. Aldehyde will be there. Double bond will be there. That is called alkene. Alkene will be there. It is only beta unsaturated. So in that case, yes, you are correct. Beta unsaturated. Now it will come. See. So when it will form into this form, now see what will happen. CH3, COH, CH2. It will bind with this one. So alpha Now see, in that case, this OH and from here one hydrogen will go. CH3 are there, so from here one hydrogen and from here one OH will go, and it will form a double bond there. So in that case, see, carbonyl compound remaining is alpha carbon. This is beta carbon. So alpha beta unsaturated. Saturated means single bond. Unsaturated means double bond or triple bond. So double bond is formed. OH is removed now. And from there also one hydrogen is removed, eliminated, not removed actually. That is eliminated in the form of water. So now CH2 will be there. So this is alpha beta unsaturated aldehyde. Correct? So this alpha beta unsaturated aldehyde is the final product of aldol condensation. Up to this, it is. Up to this, any doubt? So answer is aldol condensation. Just you remember, whenever you will see beta forms, beta hydroxy form, and NaOH is the NaOH is the reagent, and aldehyde is the reactant. That is the name reaction will be aldol condensation. Okay. Next, which of the following compound is most reactive towards? Very important question. Please make first 5-star on that. This is very important. Why? This type of, even last year also one question came. Already yesterday also I have mentioned that from electronic effect you will see inductive effect, mesomeric effect, hyperconjugation. Yes. So resonance. So from inductive effect, mesomeric effect, hyperconjugation, resonance, the main important applications are acid stability, basic stability, acid strength, basic strength, active towards nucleophilic reaction, active towards electrophilic reaction. Okay. These are important applications, and these are the master topics. These are definitely asked in GPAT also, in NIPAR also. So here you will get one question, and that is also based on the inductive effect, mesomeric effect, that is electronic effect. Okay, now what is the question? Which of the following compounds is most reactive towards nucleophilic addition reaction? So to be active towards nucleophilic addition reaction, the compound should have what should have? It should have negative charge. Why? Because the negative charge will go and bind with the positive charge. When it will have any negative charge and an electrophile positive charge will come and bind with this one, easily electrophile will add. For example, if it has anywhere any negative charge, it will be electron rich. In that case, what will happen? A electrophile will come, that is positively charged, and it will bind with this one easily. Yes or no? Please response. Yes or no? When it will come and bind with this one easily, the addition reaction, that is electrophilic addition or nucleophilic addition, will take place. Yes or no? So for that, what should be? What is necessary? The stability of the nucleophile or the stability of the negative charge is very important. Yes or no? Please response. Yes or no? So in that case, for example, this one, take this as aldehyde. In that aldehyde, CH3, C double bond O, single bond hydrogen. Now in that, this oxygen will be having negatively charged. First partial negative, if it is going there, then negative charge. Now the most important thing is that you have to understand that an electrophile is nucleophilic addition reaction. Sorry. In the case of nucleophilic addition reaction, a nucleophile will come and bind with the positive charge. So nucleophile is negatively charged. And when this nucleophile will come, definitely this oxygen is partial negative charge, del negative. That carbon is del positive. So nucleophile will come and it will bind there. Just few minutes ago, Grignard reagent reacted, right? In that also, same thing happened. That Grignard reagent, from that Grignard reagent, negative charge came and bind here. Yes or no? So if there is negative charge is coming and it is binding with this one, that compound should be having positive charge. Yes or no? If it is more positive or positive charge is stable on that compound. Okay, I'll call you. I'm in the class. If extremely sorry. If this carbon is having positive charge, then negative charge will come and easily bind with this one. Correct? So when this negative charge will come and bind with this one, when it is having more positive charge. And if this carbon is having more positively charged, but this CH3 will come and it will donate its electron, because this CH3 will show plus I effect, positive inductive effect. When it will show positive inductive effect, it will try to donate its electron to the carbon. When it will try to donate its electron to the carbon, what will happen? The positive charge will be less. It will be unstable. Why? Because electrons are already donated. Correct or not? So in that case, this will be having less activity towards the nucleophilic addition. In second option C, 2 CH3 are there. That means 2 CH3 means 2 positive inductive effect, 2 plus I effect. When 2 plus I effect, that means it is showing more electron density, more, it is donating more electron to the central carbon. When it is donating more electron to the central carbon, positive charge stability will decrease more. So that is less active than the first one. In that case, C, what is that compound? Compound C. Compound C is having a benzene ring, and this benzene ring connected to a C double bond along with hydrogen. So this is aldehyde, benzaldehyde. So in that case, what will happen? This benzene is having negative charge, right? Negative. This benzene is having a double bond. That is resonance. So what will happen? This positive charge will come and bind with the resonance. Why? Because it is in conjugation. See, pi sigma conjugation. That yesterday or day before yesterday, I have mentioned a very important point. You have to remember that. If you forget that, you will not understand the stability point of the organic chemistry. The point is conjugation. What is conjugation? Conjugation, when there is unsaturated bond or unsaturation is in conjugation with the saturated bond. For example, there are 5 types of conjugation. What are they? Pi sigma positive charge, pi sigma negative charge, pi sigma lone pair, and pi sigma free radical. These all are 5 different types of conjugation. You have to understand this, very important. Pi means pi bond, sigma means single bond, and that pi sigma pi is very important. This is the highest table. Then pi sigma positive charge, pi sigma negative charge, pi sigma lone pair, and pi sigma free radical. These all are in conjugation. Okay, when these all are in conjugation, what will happen? They are stable. When conjugation is there, that means stability is maximum. So in that case, this positive charge is in conjugation with the double bond. That means with the resonance. So it is less. That positive charge is already stable. So when it is stable, there is no activity. Like it will the nucleophile will come and attack there. Probability of nucleophile will come and attack there in the negative positive charge will very less. Probability is very less. So this is having less probability. In that again, that CH3 is there, benzene is there. That benzene is connected with C double bond and again CH3 is there. That means in that already that is showing plus M effect. That is showing plus I effect. So 2 plus M and plus I effect are there already. 2 effects are there. It is more or less active. More or less active towards the nucleophile. Why? To be active with nucleophilic addition reaction, the central atom or central carbon should be having more and stable, not stable, unstable. Unstable, but it should be having more positive charge. Okay. So in first case, only 1 plus I effect was there. In second case, 2 plus I effect are there. In third case, plus M effect is there, and you know plus M effect is far more active than plus I effect. That means metameric effect is more active than the inductive effect. That's why these 4, 3, and 2 are less active than the first one. So the answer is first one. Are you clear with that? Understood the concept or not? Why I am taking so much time in this question? Because this question is very important. This question is very important. Okay. So in that plus I effect is there, in that 2 plus I effect is there, in that plus M effect is there, in that plus M effect is also there, plus I also there. Okay now. So that means if positive charge is present in that carbon, it is less occupied or it is less stable with this one. That's why this A will be the correct answer. You understood up to this or not? If you didn't understand, you please tell me. I'll explain again, because this is very important question. You are going to get that question tomorrow. Not tomorrow, sorry, on that GPAT exam. Next question. What is the angle between carbonyl C double bond O and the bond between the carbonyl carbon and the atom connected to it? Yes, this is very important question, and it is from hybridization. So what is hybridization? How many types of hybridization are there? 3 types. What are they? sp3, sp2, and sp. sp3, when it is called sp3 hybridization, when the compound has 4 different or all the saturated, when the carbon has all saturated bonds, all single bonds. In that case, it is sp3. sp2, when the carbon has a double bond or an unsaturated bond. When it is sp, when the carbon has triple bond present. This is sp, this is sp2, this is sp3. Now you have to understand the most important point, that sp3 is highly electronegative, sp3 is highly electronegative, then sp2 and then sp1. Next point you have to understand, the bond angle between sp3 is 109 degree 28 minute. How much? In the sp3 it is, bond angle is 109 degree 28 minute. In the case of sp2 it is 120 degree, and in the case of sp it is 180 degree, because the sp will be like this. For example, you take CO2, carbon dioxide. So carbon dioxide C double bond of like this. Yes. So see, 1 2, how many bonds are there? 1 2. So it is sp. When it is sp, it is S1P1. That means 1 plus 1 2. So S1P1 means simply it is called sp. When sp, so CO2 bond angle is 180 degree. Next you take BCl3 or BF3. In that case, boron is the central atom along with having 4 chlorine, BCl3. So these 4 chlorine are in 120 degree angle with the each other. Okay. Take methane, CH4. In the case of CH4, carbon is having 4 different, all the 4 bonds, all are single bond, or it is called saturated bond. In that case, the bond angle between each bond with the other one is how much? It is 109 degree 28 minute. Okay. Is it visible or not? Are you understanding or not? I think I'm going too fast because we have very less time, that's why. Now, what is the question asked? The question is, what is the bond angle between the carbon and the carbonyl carbon and the other carbon connected to it? For example, take CH3 C double bond or CH3. Take propanone, or it is called acetone. In the case of acetone, this C double bond O is how much? It is having 2 bonds, that is unsaturation. So when it is unsaturated, 1 2 3. Single bond, how many how many saturated bonds are there? 1 2 3. 3 saturated bonds, that means S1P2. So what is that? Hybridization, sp2. And in the case of hybridization of sp2, I have mentioned just 2 minutes ago. What is the bond angle? The bond angle is 120 degree. So what will be the correct answer? The correct answer is 120 degree. Okay. You understood up to this or not? Okay, let's see the answer. The answer is 120 degree. Yes. Next question. Which atomic orbital is spherical in shape? Simple. How many orbitals are there? 4. S, P, D and F. What is S? Spherical. What is P? What is S? Spherical. What is P? Dumbbell. What is D? Double dumbbell. And what is F? Four bell dumbbell. Okay. So what is the answer? C. Orbital S, P, D, F. So that means S is the correct answer. So 2S is the correct answer. Question is, which of the atomic orbital is spherical in shape? So what is the answer? 2S. Right? Next, ether is more volatile in alcohol having the same molecular formula. Acha, ether is more volatile than alcohol. Okay. When you will see volatility or volatile or temperature, boiling point. Okay. In all that case, you have to understand hydrogen bonding. What you have to understand? You have to understand hydrogen bonding. So you have to see hydrogen bonding here. So in the case of ether, it is more volatile. That means ether is having hydrogen bonding, and alcohol is having also hydrogen bonding, but alcohol is having intramolecular hydrogen bonding, whereas ether is having intermolecular hydrogen bonding. So alcohol is having resonance structure. No. Intermolecular hydrogen bonding is in ether. Yes. Intermolecular hydrogen bonding in alcohol. Yes. And dipolar character of the ether. So in alcohol you will see intermolecular hydrogen bonding, whereas in ether you will see intramolecular hydrogen bonding. So what will be the correct answer? The correct answer is C, intermolecular hydrogen bonding. If the compound is having more intermolecular hydrogen bonding, that means it is more stable with the water. When it is more stable with the water, if you apply more temperature, then only it will get volatile. That means when hydrogen bonding is present, volatility is less. When more hydrogen bonding, less volatile. Less hydrogen bonding, more volatile. Again, intermolecular hydrogen bonding, less volatile. Intramolecular hydrogen bonding, more volatile. Intramolecular hydrogen bonding is present in the same compound. Intermolecular hydrogen bonding is present between two different compounds. And when two compounds are involved with the hydrogen bonding, obviously that is more stable rather than that of in one compound hydrogen bonding. Yes or no? So that's why ether is more volatile because it is less stable or it is having intramolecular hydrogen bonding, and alcohol is having intermolecular hydrogen bonding. Okay, na? Up to this, any doubt? If you have any doubt, you can ask me. Next, which of the following chemical bond are described by Cossel-Lewis? Obviously, very easy. Cossel-Lewis theory. What is Cossel-Lewis theory? Cossel-Lewis theory is about octet. So here is octet. Okay, octet means covalent bond and ionic bond. So which of the following chemical bond are described by Cossel-Lewis? Answer will be ionic bond and covalent bond. Yes. Let's see the answer. Yes, answer is D. Next, what is the LPC name of the following compound? Very, very easy. This is phenol. Numbering will start from here 1, 2, 3, 4, 5, 6. So 2,6 dibromophenol. So 2,6 dibromophenol. This is the correct answer. Answer is C. Okay. Answer is C. 2,6 dibromophenol. Okay. Next question. Four-membered, fully saturated heterocyclic containing one oxygen is called. Okay, that is naming of heterocyclic ring or naming of heterocyclic structure. Are you present? You people are observing the class or not? Okay, give me some hint. You are observing the class or not? Are you there? Are you people there? The class is interesting or not? You people are getting your answer or not? Should I continue the class or should I terminate here? If you want me to continue the class, at least you should respond, right? You people are getting class or not? Yes, please. Oh, okay. Thank you. So please respond and interact with me. Interacting session is important. So next, four. Okay. So whatever I have explained earlier, you understood everything or not? Hasini medulla. You understood all these things or not? Good. So next, four-membered fully structured heterocycle containing one oxygen. So whenever we are naming heterocyclic structures, we have to understand one thing. Whenever sulfur will be there, we will use thia. Whenever oxygen will be there, we will use oxa. Whenever nitrogen will be there, we will use aza. We'll use aza. Okay? Thia, oxa, aza. So again, if the cyclic structure is having 3 atoms, then tri. So from there we will use Ir. If the cyclic structure has 4 atoms, that means tetra. So from tetra we will use at. If it is having 5 structure, then 5 member, then we will use all. If it is having 6 structure, 6 member, then we will use in. If it is having 7 structure, then we will use F. Okay. For example, in the case of benzodiazepine, structure, what is benzodiazepine? Already after 3 days you are going to write GPAT exam. You should have known very well what is benzodiazepine. Benzodiazepine is a antidepressant drug acting on the central nervous system, right? So this is benzene connected with. Now see, in that 7th position one chlorine will be there. This chlorine is very important. That is electronegative atom should be present at the 7th position. This is very important. Now see, in that how many nitrogen are there? Benzodiazepine. Okay, in that C, benzo means presence of benzene. Di means 2. Aza means nitrogen. F means 7 members. See, 1, 2, 3, 4, 5, 6, 7. How many members are there? 7 members. Count. 1, 2, 3, 4, 5, 6, 7. That's why F. And IN means presence of amino group or presence of nitrogen. Okay now. So this is the simple way to name a heterocyclic structure or heterocyclic ring. So what is our question? The question is a 4-membered fully saturated heterocyclic containing 1 oxygen. So first of all 4-member, 1, 2, 3, 4. In that 1 oxygen is present. So 1 oxygen is there. Okay. Now I already mentioned just 2-3 minutes ago, if oxygen is present then it is called oxa. So see, oxa. How many member? 1, 2, 3, 4 member. 4 member means tet. Tet means ET will be there. So oxet. Okay. So what is the answer? Already answer is there. Oxet. This is the correct answer. Ir means 3 member. Ir means 3 member. N means alkane. Means all are having single bond. In means alkene. That means all are alkene. Alkene means presence of double bond. Oxat. Ox means oxygen. At means 4 member. Here ox means oxygen. At means 4 member. And A means presence of amino group. Okay. So the answer will be oxygen. So let's see the correct answer. Answer is D, oxygen. Here A-N. Ox means oxygen. At means 4 member. ANEN means here only I said ANN means presence of single bond. So here ANEN means presence of single bond. So all are saturated bond. Already it is mentioned that saturated. So since saturated, so AN means alkane. So from alkane that ANE taken. So alkane means all are having single bond. There is no double bond or triple bond. Okay na? You understood that or not? Please response. Understood or not? Response please. Up to this you understood or not? Please response or else I am not moving forward. Next question, Gabriel ring closing method. Gabriel-Ring-Closure method is employed for the synthesis of. This is name reaction. You all know very well. That is Gabriel-Ring-Closure method is synthesis of aziridine. This is a type of name reaction. Fully saturated already I have explained that. Right? Next question. The decreasing order of reactivity of the following compound towards the electrophile is. Okay, this is also very very important question. In that C, one is pyrrole. So what is the structure of pyrrole? Pyrrole means, right? So see, one is pyrrole. Next is thiophene. Thio means presence of sulfur. Next is pyridine. Pyridine means six member. E is there, like that, right? So in that, see, in that this lone pair is involved with the resonance, right? So that is involved in the resonance, yes. So it is unstable. Lone pair is not unstable. What it is called? Where is the structure? Yes. So it one is localized. So in that, this lone pair is not localized, it is delocalized lone pair. In that sulfur, two lone pairs are there. Both are delocalized, but there are two lone pairs. And in nitrogen, in the case of pyridine, that lone pair is localized. So this localized lone pair will be not stable. This is less stable. Sorry, this is not active, reactive to the electrophile. In that case, it is less reactive to this one. Why? Because in that only one lone pair is there, and this one lone pair is 100% involved in the resonance. In that case, two lone pairs are there, so 50-50. That means 50% involvement in the resonance. So that's why it is highly reactive, it is less reactive, and it is most less. That means it is even not reactive. So the answer will be first P, then Q, then R. So this is the correct answer. A will be the correct answer. So A is the correct answer. One of the following ring system can be used in the bioisostatic replacement for benzene ring in the drug design. So if this is an informative question, in that the benzene can be done bioisostatic replacement with thiophene. So what is thiophene? Thiophene means 5-membered ring present with sulfur. This is called thiophene. Why? Because this is less reactive. Already it is stable in resonance. This is less reactive. This is also less reactive. 2905. Okay. Okay, we'll discuss about this later. Okay, now later in the sense after the exam, because the cutoff will depend on the क्वेश्चन टाइप, कितना स्टाफ था क्वेश्चन पेपर और कितना मेंबर. सो नंबर ऑफ स्टूडेंट अपियरिंग द एग्जाम एंड द strength of the not strength actually, what it is called, hardness of the question. So the answer is thiophene. Thiophene means first one. Answer is A. We don't have much time, we have very less time, so we have to go move fast. Next, 5,6-methylene dioxide is treated with oxalyl chloride to give a ketoacid chloride. This method is useful for introducing a 2-carbon side chain in. Oh my goodness, this is not so important for GPAT exam actually, because this is little bit insightful question. The answer will be electron rich 3-position indole. Why? Because see, what is this structure called? This structure is called indole, right? In that case, what will happen? This reaction will take place. This is a very long reaction, and we have very short time. And what will happen in that case? In the 3rd position, 1, 2, 1, 2, 3. In the 3rd position, there you will see presence of electrophilic compounds or electrophiles. Okay, so the answer will be electron rich 3 position. Yes, yes, D is the correct answer. During the nomenclature, during the nomenclature of the heterocyclic structure or heterocyclic compound, the IUPAC name given below mentioned format. So definitely the IUPAC name is given based on first prefix, then stem, and then suffix. This is very simple question. Everyone knows that very well. That is information based question, right? Next question. What is happening in Robinson-Gabriel synthesis for Robinson-Gabriel synthesis is done for oxazole synthesis. This is a synthesis reaction. It is also a name reaction. You will get in general medicinal chemistry. Okay, synthesis reactions there you will get that. The board is very slow and we don't have much time also. Yes. The electrode potential are calculated by Ilkovic equation, Nernst equation, Stokes equation, Ohm's law. Yes, the correct answer is Nernst equation. Nernst equation, yes. And what is Nernst equation? E equals to E naught. E equals to E naught minus E equals to E naught minus 2.303 RT upon E equals to E naught minus 2.303 RT upon. Please reply or please comment down. E equals to E naught minus 2.303 RT upon NF log Q, right? This is Nernst equation. And by this, by using Nernst equation, hello, class lo yaar abhi. So by using Nernst equation, we can easily calculate electrode potential. Sorry, actually I got a call. Next, what is Ohm's law? Ohm's law equals to is V equals to IR. In that V is the potential difference, I is the current, and R is the resistance. By using Ohm's law, we can calculate resistance, right? So what will be the correct answer? Answer is Nernst equation. That means Q. Q means B. So B is the correct answer. Next, voltammetry belongs to the group of electrochemical analysis, steady state method, transient method, control potential method, and charge transferred by migration. So what is the correct answer? Steady state method, transient method, control. So answer is transient method. Next, mass analyzer in FTMS is sector, time of flight, quadruple, orbit. Answer will be orbit. Answer is orbit. Orbiter is also called FTMS. It is also called FITMS. FITMS. And what is the full form of that FTMS? FTMS is Fourier transform mass spectroscopy. Okay. Next, identify the peak corresponding of Lafferty rearrangement in the following compound. So this is very important question. Put 5 star on that question. Lafferty corresponding rearrangement in that always question are asked in the GPAT exam. So in that what will happen? First we will calculate the mass of ion. So here if we break this compound, obviously if we break this compound, where it will break? Alpha, beta. Here it will break. Why? Because if we break there, if positive charge also come here, if positive charge will come here, it is also be in conjugation with pi sigma positive charge. If negative charge comes here, it will also be stable with that pi bond, pi sigma negative charge in conjugation. Right or wrong? So when it will be in that conjugation, that will be more stable, and when it is more stable, bond breaking will take place here. So when it will take place here, bond breaking. Now what will happen? CH3, C double bond O, CH3 will form. So what is the molecular weight of CH3, C double bond or CH3? Molecular weight of carbon is 12. 12 into 3 means 36. Next, molecular weight of hydrogen is 1. 1 into Hydrogen is 1. 1 into 3, 3, 6. 6 means 6. Plus molecular weight of oxygen is, what is the molecular weight of oxygen? Oxygen is 16. So 16 into 1, that means 16. So how much calculate? 6, 6, 6, 3, 9, 59. Because 3 plus 1, 4, 4 plus 1, 5. So what is the closest to 59 is 58. So 58 is the correct answer. You understood that or not? 16 plus 6 plus 36 is 59. So closest to 59 is 58. So 58 is the correct answer. D is the correct answer, right? Next, formation of quasi-molecular ions is possible in which of the following ionization method? Quasi-molecular ions is possible in chemical ionization, electron import flame. So answer is chemical. Yes, chemical ionization. Yes, chemical ionization. Next question. In mass spectroscopy, M plus 29 peak may be observed in chemical ionization. It is also chemical ionization. Next. The board is not working. You people are saturated or not? The board is not working. If you want to drink water, go and drink water for within 1 minute and come again. Come back again, okay? Take some break for 1-2 minutes. So ammonium salt of sulfuric acid is used as an indicator, is also called as murexide. Yes, B is the correct answer, murexide. These are direct questions. Next, in titration of iodine with sodium thiosulfate, the equivalent weight of sodium thiosulfate is 248. This is very important and this is very easy question. Molecular weight of sodium thiosulfate already given 248. What is the structure of thiosulfate? Sodium thiosulfate Na2S Na2S2O4. In that Na2 is there, that means plus 2. Sodium is having plus 1 charge. Plus 1 into 2. That means each one is having plus 2. That means sulfur, sulfate is having plus 2 charges, minus 2 charge. Minus 2 charge. And when it is having minus 2 charge, 248 divided by 2, what will be the answer? 2, 2, 1, 1, 2, 2, 4 and 2, 4, 8. So 124. 124 is the correct answer. So this is the B is the correct answer. Okay. See, the board is not working. What we can do? The board is not working. It's stucking again and again. So we will complete. We are going to stop the class here. Okay, the board is not working because of technical issues. We will complete here. Okay. I hope you people understood the class up to this. Okay. So study well, keep revising more and more. Don't study new things now. Keep studying. Study jurisprudence because direct question will be asked from jurisprudence, and study Pharmacology tables, and study mechanism of action and classification of from pharmacology. Contraindication will be also asked. Unwanted effect also asked, but mechanism of action is more important. Along with that, some important points will be there from drugs. You have to understand that. In organic chemistry, study electronic effect. Medicinal chemistry, study based on the structure of the drug. Structure-based question will be asked. So many structure-based question will come. IUPAC naming will also come, and that IUPAC name of different drugs will come. And from the jurisprudence, direct question you will get. That's why you should study that jurisprudence. It will be very helpful for you to score more marks. Okay, keep revising more and more. Don't study new things. study less new things, but revise more. Okay, thank you so much.